everyone. Good afternoon. Welcome to afternoon session of the Science Week 2026. My name is Khawla Al-Isri and I'll be your host of today's session. This session is inspired by UM6P vision, One Health. This vision is an interaction between health, human and ecosystem and environmental health. And what makes this session special is that 35 students from all over UM6P have worked together on this idea. So this session will start by introduction of the One Health concept, then explained through a video, and a discussion will be held by students from different perspectives and discipline. And we will be having a debate, we'll questioning whether the One Health concept can achieve the environmental sustainability. And at the end, we will be conclude with a showcasing project inspired by One Health in a real district. So I invite all of you to stay with us till the end to this session. So now, without further ado, we're going to start by the first first part of the session, the introduction of the One Health concept. Please join me in welcoming Rida Moqir, a PhD student from the Center of Sustainability and Soil Sciences.
Thank you, Khawla. Hello, everyone. Good afternoon. My name is Rida Moqir. I'm a PhD student at the Center of Sustainable Soil Science at the College of Agriculture and Sustainable Environment. And it was a pleasure for me to be the project facilitator and coordinator of the student-led activity during the Science Week. This session is designed by students, and it's about the One Health. So, what is exactly the One Health? First, it's an initiative adopted by UM6P under the leadership of our president, Dr. Hisham Al-Habti, and Professor Mustafa Al-Buhsini, Agrobioscience Program Lead and Associate Dean of Research of the College of Agriculture. And as the expert explained in the morning session, in a very simple word, the One Health is a collaborative multidisciplinary approach to achieve optimal health outcome by recognizing the interconnection between people, animal, plant, and their shared environment. So we strongly believe we cannot protect human health without protecting environment and animal health. And we are currently living in a world, especially Morocco, with a very fast development and urbanization. Agricultural land decreasing and infrastructure are growing. So we've asked ourselves how we can create a city that adopt One Health concept and respect the balance between nature, human, and health. So this is how the idea of the One Health district was born. Many students from different backgrounds were asked to imagine how a pre-urban city would look if it's adopting the One Health concept. So I will explain the project methodology because the project methodology is as important as the final outcome of this project. Today we will see a case study of Benguir city, but the methodology is applicable all over Africa, and we can use it to develop districts, but we need to take into consideration the cultural context, the social context, also resources and environmental context. So as I said, different students from different backgrounds and disciplines from UM6P, plant discipline, remote sensing, health, business, come together, and we've gave them an individual exercise. We've asked them to propose one unit within that district. One unit, I mean one building within that district that can solve a daily life problem, and it should be inspired from their disciplines. And of course, it should be interconnected with other disciplines. And then those students were grouped by discipline, and they went through a group or collaborative exercise. So each discipline developed a concept note in which they described how they see their discipline within their district, how we can monitor the discipline within that district, the technology, the priority, and the exercise had been done, or the concept note developed by architecture or sustainable architecture student, environmental sciences, medical and health, agriculture, business, education. And we've collected all the outcome of the individual exercise and the group exercise, and we gave it to the student of the School of Planning, Architecture, Planning and Design, so they can study the feasibility of the idea proposed by those young researchers and how they can make them interconnected, how they can apply it to the social and cultural context of Benguerir city. As I said, the methodology is really important, not only because this is how we did the project, but it shows the real convergence. We had the participation of more than 35 PhD candidates and students from more than 14 UM6P program, people from plant sciences, water, soil, agribusiness, medical health, from different UM6P program, and it shows how UM6P is implementing the convergence methodology within the university, and also it shows how the students, they can converge when the aim is protecting the human health. All what we did will be presented into 4 activities. The first one, which is a concept video, pixel art video made with AI. I will tell you why it's AI and why it's pixel art video. First, the pixel art video, it's inspired first by UM6P architecture. If you can see UM6P, you will notice there is a lot of squares in UM6P. So we were inspired by the architecture of UM6P. And the second thing is the AI, is the pixel itself. Each pixel represents a very specific color, but when they converge, they show a bigger, beautiful picture. And for the AI video, since there's a lot of discussion rising currently about AI, we will show you that AI is a really powerful new format tool for new format presentation, but we need to monitor it and use it ethically. The second thing is an interdisciplinary panel. In a panel, a student and a PhD candidate from different backgrounds, they will define how they see the One Health from their discipline. And the third activity is a strategic debate in which we will question the One Health. Is the One Health really a feasible model to achieve sustainability? And the third, which is the application and the implementation of all what we have discussed before and presented, and it will be presented by the student of the School of Architecture, Planning and Design to implement the idea proposed by the students in Benguerir city. Our aim is not to stop this project at the Science Week. We believe that with the help of experts, we can grow further and make it even a reality. And also, we would like to thank Professor Mustafa Al-Buhtini for this opportunity, Professor Ali Al-Bittai from the Center of Remote Sensing Application, and Professor Tariq Shfadi from International Water Research Institute for their support, guidance, and help. And also a special thanks to all the students that participated and contributed to the project and will be presenting today. Thank you, everyone. I hope you enjoyed the session.
Thank you, Rida, for the presentation. Now, let's explore the One Health concept through a video, pixel art video. Please welcome with me Mohamed Saou, a PhD student from Agrobioscience program.
Hello, everyone. So my name is Mohammed. I'm a PhD student from Agrobiosciences department. So before we begin, let me introduce the video. It's inspired from pixel art style. So each pixel has its unique color and identity, and when they are brought together, they give us a big and clear image. And that reflects the architecture language of UM6P, built on modular squares, and also the One Health district that brings the different disciplines to make an integrative system. So the visuals, normally they are illustrating the idea of convergence. So bring in small details into something that's meaningful. And last and not least, I want to thank Reda and Reza for their contributions in making the video. And I hope you enjoyed. Thank you.
Morocco is urbanizing at unprecedented speed. Cities extend outward, steadily absorbing peri-urban farmland and ecological buffers that once stabilized the urban-rural interface. This transformation is not merely spatial, it is structural. It reshapes land, ecological balance, and the long-term conditions of urban stability. As soil is sealed beneath concrete, biological functions decline, water infiltration weakens, microbial ecosystem fragment. Urban expansion begins to destabilize the very environmental systems that sustain it. The issue is not growth itself. Growth is inevitable. The question is whether expansion can occur without eroding environmental resilience, food security, and long-term public health.
It really is a beautiful evening.
One Health advances a fundamental principle: human health, ecological systems, plant life, and animal life are biologically interconnected. Health does not exist in isolation within institutions. It is embedded in territory. It is shaped by land, biodiversity, water, and design. Modern systems are built to respond to crises. They intervene after disruption has occurred, but resilience cannot rely solely on reaction. One Health shifts the paradigm toward prevention through design. Instead of expanding reactive infrastructure, we redesign landscapes to reduce systemic risk before instability emerges. The One Health district translates this philosophy into territorial form. It is neither a farm nor a park. It is an integrated peri-urban system composed of scalable interdisciplinary units designed to function as preventive infrastructure. Within this district, agroecology regenerates soil, research transforms land into living laboratories, education builds ecological literacy, architecture responds to climate constraints and resource limits. Each component reinforces the others. Each discipline strengthens the system as a whole. Agriculture, environmental science, public health, renewable energy, business and urban planning converge into one coherent spatial ecosystem. Sustainability becomes structural rather than symbolic. Integration becomes operational rather than aspirational. Through student-led design laboratories, knowledge becomes actionable, theory becomes territory, peri-urban land becomes embedded resilience. Cities require lungs, structurally integrated ecological systems that sustain productivity, stability, and well-being. The One Health district propose how to build them. Integration is not optional. It is the foundation of future urban stability.
Thank you, Mohammed, for this wonderful and creative video. And now, after we have a better understanding of One Health concepts, we're going to move to the next session, which is the panel discussion. where students from different disciplines and perspective will give or share their perspectives on One Health concept. To guide this conversation, please welcome our moderator, Umayma Ulaisri, a PhD student from African Research Center on Air Quality and Climate. She will introduce the panelists and the flow of the discussion.
Ladies and gentlemen, good afternoon. Let me start with a quick question. Do you believe that your health only depends on the water, on the food you eat, or the doctor you visit? What if I told you that your health depends also on the air you breathe, the water you drink, and even the health of animals that surround you? We often think of these things separately. When we say health is medicine, agriculture is soil or food, and environment is something else out there. But in reality, they are all connected. And this is what exactly is the One Health approach. It is a very simple idea, but a very important one. This session, One Health in Action, Bridging Disciplines for a Resilient Future, is not just about sharing knowledge. It's more. It's about connecting perspectives. Because the challenges we are facing today, from the climate change to food security, water scarcity, or even public health issues, are too complex for one field. So today, we are going to explore one question. How can we work together in order to build a more resilient future? My name is Ulaisri Umayma. I'm a PhD student in African Research Center on Air Quality and Climate. And I'm going to be your moderator of today. Very briefly, here's the session, how it will work. First, I will introduce my panelists. Then we will move into the discussion. Then I will open up into the audience in order to take your questions and end up with the very last one. I'm very happy to introduce from the air quality, Iman Qadiri, PhD researcher working on air quality and climate, working specifically on ammonia emission and its impacts on the environment and the human health. From the water field, please welcome Ibrahim Ben Seh, PhD researcher in the International Water Research Institute. Within the same field, we have Yassine Sambati, PhD researcher in the Environmental Assessment and Desalination Technologies. Moving to agriculture, we have Intisar Maamin, PhD student in the Environmental Plant Nutrition Institute. From agribusiness, we have Alauddin Momin, master's student in agribusiness and innovation. And within the same field, we have Fatiha Abdul Salam, bringing a background in veterinary medicine. And finally, we have from the public health, Mr. Amin Mohammed Ta'a, a public health specialist and a PhD researcher. Thank you all for being here today. So I will ask one question shared between all of you. Can you please make clear the link between the One Health and each of your fields? So we will start with you, Iman Qadiri. How can you define the link between the air quality and the One Health approach?
Thank you, Umayma. So at the very first moment of birth, most people think that the first thing the baby do is crying, but after crying, of course, baby does cry a lot, but it's something more important the baby breathes. So before we speak, before we open our eyes, before even we cry or understand where we are, we breathe. And that breathe, that first thing, become something normal that we do more than 20,000 times a day, and without even thinking about it. And here, the importance of that, the quality of that air you breathe, because the quality of the air, the pollutants that are on the atmosphere, the concentration, the levels of the pollutant present in the atmosphere can easily impact the quality of the breath, that one breath you take. And we can talk about the different pollutants here, like the PM 2.5, the PM 10, the sulfur dioxide, or different pollutants like presented in the atmosphere that can impact our air quality, and also the visuality, the health, the ecosystem, and also the climate patterns. Here we can talk also about the second key element is the climate. Because we talked lately about the climate change. I think we are all familiar with the climate change and all the consequences we have, like in Morocco, the extreme events, the droughts, the floods, etc., that we are experiencing lately, that can impact the different pillars of the One Health approach. It impacts the human health by the increase of different respiratory or cardiovascular diseases. Also, the animals are vulnerable to the air quality and climate conditions and extreme events conditions. By influencing the productivity, also the habitat, and I can talk here about my favorite insect that I didn't see like years ago, and I can't blame someone else or something else other than the climate change or the air quality. And also I can talk also about the ecosystem or the environment, because here we have to mention the importance or the key role that air quality and climate are playing in the water scarcity, the degradation of soils, and different consequences on the environment.
Okay, thank you so much, Iman. We see that you've reported very interesting concentrations there, and we'd love to come back to that later. From the air quality, we will go to the water fields now, and I would love to know, what do you think, Ibrahim? What's the link between water management and water sector and your field, which is water?
Good afternoon, everyone. So today we address the role of water as a critical interface connecting human health, animal health, and environmental ecosystem. As you can see, water is a center heartbeat interconnecting animal and human and environmental health. So we should look at two sides of lenses in water. So the first one is the quality of water. Contaminated water is a direct vector for blood-brain diseases in human, chronic intoxication for animals, and also the collapse for environmental ecosystem. And when we talk about the quantity, scarcity is eventually equal devastating. Each force reliance use unsafe source of water. So when water is not unsafe, it causes hydric stress. So now we move on to the planetary boundaries. As we can see, in 2029 and 2030, our freshwater use was in the safe operation space. At the largest, in 2023 and 2025, we can see that we consume more than the Earth can recharge, moving to the high-risk zone of global stability. For Morocco, this quantitative stress is a daily reality, and it's further compounded by a geographical injustice. As we can see, for Morocco, in urban areas, we have more than 98% of population that have access to basic drinking water, while in rural area we have just 80.3% of population that have access to basic drinking water. Finally, we must look at the hidden side of our effort sanitation. We have wastewater plants. They are designed to clean water, but unfortunately, they generated a massive byproduct, which is sewage sludge. So this byproduct is, unfortunately, in Morocco, is just poorly treated and simply dried and dumped into landfills and also into open nature. So that can make danger for environmental ecosystem.
Thank you so much, Ibrahim. Within the same field, we have Mr. Yassin. Please, can you share with us, you are in the same field, yes, of course, but I do believe that you have different perspective. If you can explain more the link with the One Health.
Yes, absolutely. Thank you, first of all, and thanks for the audience. So just to explain how my field, which is water, but I'm working mainly on desalination, membrane-based technologies for desalination. And I would like to express the difference that is within the same field between me and Mr. Ibrahim. So I'm mainly working on desalination, and the main contaminants that we might have is salt, which is something that we eat all day, that we eat in every meal. Believe me, Moroccans eat a lot of salt. So I try to incorporate how water can be presented as the epitome of the One Health concept. And starting from the environment, of course, we can say that we have the main thing that we can consider, which is the desalination plants. I mean, we started creating and constructing desalination plants decades ago, and it represents this dilemma between the fact that it is a very interesting thing that it is a source of provision to the water and to the untreated or desalinated water, but at the same time, it gave us some sort of waste. And you can see that this waste can be through the whole environment. It can be through the water, through the air, and through the soil. So just the desalination plant itself, it's a representation of the One Health concept, that it goes all the way. One other thing, moving on to the human health now, that you can see in the graph that I presented, that mostly more than 1 million people or more than 1 million death risks are happening because of the unsafe sanitation and the unsafe water resources. And that is in the whole world. And to keep it more specific in Morocco, you can see that, I mean, in the urban area, we have approximately more than 90% of the water resource that is safe and available. But in the rural areas, we have more than 50%, which is, if we want to see it on a global level, it is one of the highest in the African continent, but still it is in the low end. And the last thing about the animal health, which is my favorite part, this is called I tried to show the prettiest picture of this animal, which is the blue-eyed turtle. And it's an endemic species, actually, in Morocco, for Morocco, and it's in the Daraa Valley. near to the Zagora and in those regions. And actually what is interesting about this animal is that it is very resistant to salt, because that region is known for having brackish water, salty groundwater, etc. But now, because of the evaporation, if the use of the groundwater in agriculture and watermelon cultivation, that the salinity rises to the point that even this animal, which is salt resistant, is now suffering from the high amount of salts. So it is kind of really interesting to put the fact that this animal, that's one of its main advantages and its main characteristics is that it is resistant to salt, and now it's one of its main vulnerability points. So it is really interesting, and to put all that into perspective is that water can go all the way from human health, or let's start with environment, and then, of course, when you talk about environment, you talk about how it affects the human health and the animal health.
Thank you so much. From the water field, I would like to invite Intisar to clarify more about the link between agriculture this time and the One Health approach, please.
Good afternoon. Thank you for the introduction, and thank you for organizing this very interesting panel that gathers different fields of expertise with one final aim, which is One Health. So for my side, I will talk about One Health in an application in a very important agricultural sector in Morocco, which is olive production, and talking about the link between nutrient management and the One Health concept. So olive farming in Morocco is an important agricultural sector by covering above 1 million hectares, supporting many farmers and rural communities, but there is a lot of challenges, especially in terms of the production, if we compare the national production with the Mediterranean neighborhood, and also with drought, especially when we have above 60% of the total tree area under rain-fed system. So my research is focusing on soil nitrogen dynamics, which means that I'm working with nutrient management in Moroccan olive agroecosystems. Why choosing nitrogen? Nitrogen is a very important element in olive production. And if we do not have enough nitrogen in soil, we can have negative effects in growth, yield, and also olive oil quality. So we have here this aspect of One Health related to the quality of what we eat as olive oil. And also nitrogen is very hard to study because it's mobility in soil. So there is a very tight relationship between water availability and nitrogen. So as my colleague says, water is a very important component in the concept of One Health. And if we introduce factors that are linked to water, so here we see the importance of nutrient management as one of the main components of One Health in the side of agriculture. So nitrogen is very important because it's affecting the productivity, the agricultural productivity, but also it's complex in terms of its biogeochemical flux. So here we introduce topography, we introduce climate in link with the biodiversity we have in these olive agroecosystems, because we do not have only olive. We have soil, we have the above ground biomass, we have the climate in these olive agroecosystems. So if there is like a negative or a positive balance of nitrogen in the management, it's going to affect positively or negatively the sustainability of the system. So here the aim is to manage nutrient management, especially through nitrogen, to attain the balance between sustainability, the protection of environment, and the protection of the natural resources, mainly soil and water, and also to attain the balance with the food security and the human nutrition security. So this is the point, and thank you.
Thank you so much. Because sometimes, Ibtisam, in the same field of agriculture, but this time with more business-focused field, and I invite Mr. Alauddin to explain a bit the link between the agribusiness and the One Health approach, especially that it is quite hard to make the link if we compare it with water or agriculture or even public health. Alauddin, the word is yours.
Thank you, Umayma. So we are talking about the idea that the One Health is the animal health, the human health, and the environment health are all one thing and not separate things. And it does make things because we cannot have healthy people without healthy food systems, and we cannot have healthy food systems without healthy environment. So it does make sense, but there is a missing element, which is the economical health, because a farmer cannot make a profit, won't care about the soil health. And a community who is living on just in the margins won't invest in water, clear water, clean energy, and the prevention of disease. So I believe it's a correct equation, but it lacks one element, which is agribusiness. And when we look to the point, we see that we are not lacking an agricultural issue in Morocco, because everyone in this room knows that Morocco has a water crisis, it has a climate impact effect, and it has a food system impact. But if we compare the details of the Moroccan agriculture, the problem is not here, but is in the value. And let me explain why. So the agricultural sector employs nearly the half of the Moroccan workflow. And at the same time, it consumes the majority of its natural resources, especially water. But when we see the GDP that this sector creates, it only creates 10 to 50% of the Moroccan national GDP. So when we look at this gap, we can understand that something is missing, and we can raise a lot of questions. And if we dig deeper, we can find answers, because the majority of the whole process, which is processing, packaging, branding, and distribution, is done somewhere else. And this is where the value, because according to the FAO, 80% of $1 gained by an agriculture is gained in those parts of the value. But that leaves only 20% or less for the farmers, the ones who are taking the risk, the ones who are doing the hard work and everything, yet it's not profitable because we are, Morocco, exporting only raw products, agricultural products. So that's correct, but I think it's incomplete. If we want to achieve the One Health, we should make it a profitable business model, because a farmer won't care about the future of his soil if it doesn't even have a future. He should survive the short term so he can reach that sustainable future. And this is why, this is how we integrate agribusiness. We should build a whole system for the farmer, a system that includes all the parts that we are talking about, the processing, the branding, everything, so he can benefit from all the value, and then all the equation would change. He won't see water impacts and the energy, clean energy, the disease prevention. He won't see it as a burden anymore, but he will see it as something he will get rewarded for after he take care of it. So I think that there is no future without the profitability part. And if we're talking about One Health, it will stay just a theory without agribusiness and the economical aspect.
Yes, as you said, the economic importance still important in the area of the agriculture. Within the same field, we have Fatiha, but this time with animal health focus. Can you please give us some insights about the link with the One Health approach?
All right, thank you so much, Umeima, for that. Because of my background in veterinary medicine, I'll be talking about animal welfare and zoonosis in Morocco, like a One Health perspective. So animal welfare and zoonosis is one of the major challenges that we face in the animal health sector here in Morocco also. And this is due to the increasing human, animal, and environment interaction, making a rise in like public health risk. In addition, rabies and also tuberculosis is pretty much endemic here in Morocco. And so these are some of the challenges that needs to be addressed. When I talk about animal welfare, I won't just talk about stray dogs and cats, even though there's a rise in population in stray animals here in Morocco, which has also caused an increase in conflict between humans and animals, because you get aggressions from some of these animals and also like conflicts or scratches from them. But also in the livestock system, we have this issue of animal welfare, whereby you see when they're transporting animals from the farm to the market, the conditions, stressful conditions for these animals, also in the live animal market. And also when they want to slaughter these animals for consumption, they actually mishandle these animals. Then also talking about rabies, like the zoonotic part, we've seen that there are about 400 cases annually of animals that have rabies here in Morocco, and also 100,000 bites annually have been recorded. When you get scratches, women complain that, oh, I got bitten by a dog. We have like almost 100,000 cases annually, and over 30 plus human deaths from rabies in Morocco. And this is a serious cause for public health concern. And also tuberculosis, you have like in thousands, like 30,000 cases annually. And some of these issues is due to like behavioral behaviors, because see people consuming unpasteurized milk and also consuming meats that have not been properly checked or inspected by the Food Safety Authority. In 2019, Morocco launched a national program called TMVR. So I'll give a little bit explanation about TMVR. TMVR is trap, neuter, vaccinate, and then you return. So stray animals are picked up, they are neutered. That means their reproductive system is actually removed to stop them from reproducing in the community, which can actually help in reducing their population. Then they're vaccinated against diseases such as rabies and also treated for infections such as worms, which could also pose a public health risk to humans. They are tagged with a collar on their neck so that people community can know that these animals have actually undergone this process, and then they're returned back to the community. So they're just like your normal, friendly human dog. Also, I know that the National Food Safety Authority, which is called ONSA, they do a lot of work in terms of meat inspection and also disease surveillance system. They also monitor livestock trade and movement within Morocco. So these are actually strategies that Morocco is trying to like implement to put these things in check. However, a lot still needs to be done. And then talk about behavioral changes. We need more awareness. Let people know that these things are causing a serious public health risk. And then, like, we should strengthen veterinary services and community animal health workers here in Morocco so that they can carry out surveillance and then vaccination of these animals. And I'll just also want us to embrace a One Health approach, because when you have sick animals, they are like a reservoir for humans getting sick. And also when humans are sick, or when the environment is not healthy for both humans and then the animals, it could really cause a lot of concerns and problems in the community. So we really need to come from a One Health perspective. Do not address these issues like in isolation. You address them together as one. So yeah, thank you.
Thank you, Fatiha. As now we saw like air quality, water, agriculture, and now we are pretty sure that all of this converge into the public human health. That's why I ask Ayman, what's the link? I know it's crystal clear there is a link, but we would like to know more insight from your side as expertise.
Well, thank you first of all, Umayma, and thank you all for having me here today. I think I'm in the sweet spot to bind all of what has been said together. And I wouldn't want to get too technical about it. I would rather give you a short story. Well, you know, in the 19th century, there was an architect in London who tried to map how cholera spread through London. And it was through that intervention, the way he mapped the way cholera spread through London, that we discovered that cholera actually spread through water, which gave us an idea about something very different in health, in public health later on, that we call determinants. Well, to 100-year upwards, we do not talk about health as being medicine, but rather being an intercollective determinants that would actually determine how you would go on to live your life. It could go from social, could go from environmental, could go to political. And I think it all integrates and share the core principle and values of what One Health is. Because One Health is all about collaboration, it's all about trust, and it's all about having the mindset and the right spirit that we do not need to treat patients. What we actually need is to not have patients in the first place, which gives us an idea about a certain change and shift in the paradigm with which we see health. We are switching from a position in which we only care about treating patients to another where we should not have patients to begin with. And this is how you actually evaluate a really good healthcare system. So I think from my personal position, and I honestly work a lot on behavioral health and how it integrates with public health, there are a lot of spectrums, especially within the One Health frame, that actually really need a lot of emphasis. And I would think that mental health, behavioral health, sustained behavioral change could be one of a very interesting impact, not only on the person's health, but I think it's actually a loop in which whenever you improve a person's behavior in regard to their health, it also impacts and influences the way he handles his behavior around him, which creates a healthy loop.
Okay, thank you so much. From your answers, we can see how much there is a big diversification and different perspectives. Now we need to connect them, and I want to start with a very interesting sector and a field in Morocco, which is the water field. And I want to ask you, Yassine, what's the real and challenges today in Morocco within the water sector? Is it a question of scarcity or quality or management?
Well, thank you, Umayma, for this really interesting question, actually. And it's sort of multifaceted. And I mean, I don't know if you know, but just at the beginning of this year, the UN stated that we reached the state of global water bankruptcy.
Yes.
So just let this word sink in.
Mm-hmm.
And the meaning of it, or the definition behind it, why they choose this global water bankruptcy actually is that they mean that the water resources that we have reach the point of irreversibility. That means that we don't have even the opportunity to make them reversible, even with the rain, even with any conventional water resources. And that goes also, this is a bit global, but that goes also with the regional context within Africa and also with Morocco, with 6-7 years of drought. So it's sort of emphasized in Morocco. So I would say if I had one answer and I had to choose one, I wouldn't be able to. But if I had to order them, I would say that strategy a bit goes at the end, because you cannot you cannot manage what you don't have. And I would say that it is the supply of water and the monitoring of quality. A bit of hybrid system between them, that would be the great answer to this. And the fact that, I mean, still now we have desalination plants as a source of non-conventional water, and it's used for drinking, and it's used for agricultural purposes in some cases. But the problem is that we go through the big point of view of industrializing these desalination plants instead of putting also some possibility or opportunity to put decentralized plants within remote areas, within rural areas. As you can see in my presentation, less than 60% of water is available in the rural area. So I would say it should be a hybrid system between water management, water supply, and water monitoring. And the water management would be at the end, when we have enough water to manage.
Yes, as you said, it's not only about water access, but also about the effects of this water on the human health and on the ecosystem. As we all know, this year was a bit different with the high precipitations that comes with a lot of damage. From here, I want to ask Ibrahim, which impact of water issues is more critical within the context of Morocco today?
In the context of Morocco, I believe that the most critical impact is not a single point, but a synergy between the water scarcity and also the failure of waste cycle. So if I had to prioritize, I would say the injustice, the sanitary injustice. When we talk about the global debt in Morocco, we see the immediate crisis is the 80% gap between rural and urban areas access to basic drinking water. So if water is scarce and the available water is of poor quality, it's directly causes waterborne diseases for human and also intoxication for animals. Also, they do disequilibrium for ecosystem health. So, if I would say one answer is the injustice sanitary, and also when we talk about the wastewater treatment plants, we talk about sludge. When it's not very treated or not very really good treated, just we put it in the open nature, so it immediately causes groundwater damage. So that's at all. That's my
Yes.
answer. So.
Like you did report a very interesting and shocking number of the annual of person who died in the world because of sanitation and water access. 1 million person. Like imagining in 2026 we still have this shocking number is very intimidating. And within the same field, I know that Morocco do a lot of efforts in order to find solutions for those challenges. Like we have the national strategy of water, we have programs for conventional and non-conventional water management. The question is for both of you, since you are in the same field, what do you think is still missing in our national water strategy in order to be more effective on ground? Yeah, you can start, Yasin.
Okay. Well, yes, I mean, that's true. I would agree with you in the first half that Morocco does have a national strategy for water, either for management or supply. So that is true. However, yes, there is a missing, I mean, I would say missing keys or key points, not even one. But the two things that I focus on, mainly on based on my work in desalination and also during the first years of my PhD and also my master's, I worked in many regions where water is there, but it's saline and it's not treated. And while this problem is happening, at the same time, we're searching in the same region of ways not to adapt with the situation through decentralized water system or desalination systems or small desalination plants, but rather we are trying to mitigate this problem, which is not a bad thing, but it is sort of like the main focus of the Moroccan national strategy, which is focusing mainly on mitigation and not on adaptation, which is the main idea of sustainable development, mainly, that there should be a mitigation and then adaptation, of course. So there should be an adaptation part. And also, the last thing is that we need to include more citizens into the action. We need to raise awareness because in many regions, people don't know what the problem is. They just get a response or a signal that their crops are not growing, their health is being deteriorated, but what is exactly the answer for that problem, they don't know. So the citizen awareness and also including the citizen into the system, it's really interesting. So we need to also focus on, within the One Health concept, on the participatory action research, which is including the citizens and the public into the research methodology, into labs, into different methodology of researching, of collecting the data. So that is really interesting and needs to be added into the Moroccan national strategy.
Yes, thank you so much for your opinion. What about you, Sir Ibrahim? What do you think?
Me, I think I'm gonna say the same thing. In Morocco, we need urgently a shift or a paradigm shift, which means that we should move away for a large infrastructure and centralized system to solve the problem for rural areas access to drinking water. We should have some decentralized system, which means that can operate without heavy infrastructure, we can just working by which means that every house that our system that can produce of a house that the minimum of water that he need for one journey. So it's a good. So for me, I think the best solution or the needs is decentralized system. Yes, decentralized system that can, and also agile approach, which means that in rural area they can apply it or they can work with these systems, and also the system should design with the technical and the economic realities of rural areas and isolated villages. So that's all my opinion.
Thank you so much, Ibrahim. Now, from water to a less visible component and essential elements also, which is air. Iman, can you please tell us what's the main challenge regarding air quality in Morocco today?
Yeah. Actually, I believe that the globe is facing a critical situation regarding the climate change and also the air quality. Africa is known by the less continent in emissions, but the first one in the consequences. And Morocco is not an exception. Actually, Morocco is facing a very challenging impact. We are talking here about both emissions, both sources. We are talking about the natural sources and also the anthropogenic. Beginning by about the natural sources, here we have, like I can mention the dust event we have, especially in the Saharan area. Also, we have different emissions from agriculture and so, and also because of the economic, urbanistic, and also the social development, we have an increase on the different emissions from the industrial development, economic, and etc. And from that, we are also facing the impact of these emissions, the air pollution and the climate change. And I can mention as an example the floods we just experienced in the north part of Morocco. Also the increase in the temperature, and the different situation linked to directly to air pollution and climate change. And I wanted to. You asked me about the concentrations.
Exactly, I wanted to ask about
about the concentrations of the PM 2.5 and PM 10. As an example, I can tell that here in Morocco, we are facing like a 6 time the limits of PM 10 that the WMO just in the limits. Yeah.
It could be a very challenging one of kind of pollution within the air quality. Now that we talked about air quality or air health, also water quality, both converge into the soil quality. For there, I want to ask you, Intisar, how does improving soil health impacts directly the human health?
Thank you, Umaima, for this question. I will try to make my answer very light. So, starting with soil health, when we talk about a healthy soil, we talk about healthy physical soil, chemical healthy soil, and also biological healthy soil. So all this combination makes a soil healthy. So if a soil healthy, the food we grow on is healthier too. And if the soil is clean, the atmosphere will be cleaner and also water. So in short, if we take care of our soil, we take directly and indirectly taking care of ourselves. So it's a simple equation, but it's very demanding in terms of practices and in terms of management to take into consideration soil health as an indicator of sustainability, as an achievement to achieve, to say that we are applying the One Health in our agricultural systems.
Thank you, Intisar. Thank you so much. But even with a good soil, we all know that there is another challenge, which is the economic one. For this, I ask Alauddin, what is the biggest barrier preventing farmers from being included in the value chain? Because you mentioned earlier that this is the big challenge in agribusiness.
Yes, for sure. Because farmers don't just want to sell at the early point. They have no option because that's the least profitable option for them. And I believe the problem in here is that we have a great gap between research and innovation and farmers. Because if we see globally, the dominant countries where they are having a great economical impact of the farmers, we see that they are implementing innovation and integrating technologies. So if we see Morocco, we are doing a very good job in the research, but if we go to the field, it's very disappointing. So if we can bridge this point between our research and innovation and the farmers, we can do great things. And that's a change from our side, but we need another change, which is from the farmer side. Because as a person who tried to be an entrepreneur with agriculture, so I talked with a lot of farmers, and they lost confidence in everyone. So if I tell them there is his products, he will benefit you in the long term, he will say, this is not, I only care about the short term, I'm not going to survive to reach that point. So we need also to gain back the confidence of the farmers so they can trust us again, and they can trust our research and our innovation. Then we can see a real implementation of the One Health, because there it's not just a social responsibility, it's a profitable business model.
Thank you. It is good to see the agriculture from a business side. Now we are going to the public health sector. Ayman, please, what is the most critical risk today linked to human health within the One Health approach?
Well, allow me to say that each of our colleagues have mentioned enormous public health issues or major public health issues that could be related to health, soil, air quality, could be related to the quality of food that we consume. Because I mainly think that when we talk about food, there's a huge issue with it. It could be our top priority, public health priority of today, especially ultra-processed food, and also accessibility and access to healthier options within the Moroccan markets. This is a huge problem for us. When we talk about major issues, again, we talk about chronic diseases. And as you know, chronic diseases aren't mainly caused by an agent. It's not caused by a bacteria, it's not caused by a virus. It's mainly, and most of the times, caused by our bodies having a certain condition. And most of these conditions are usually linked to determinants of health. So people usually with the higher concentration of a certain metal could possibly have a disease or a certain disease. And it could go on to almost every single condition that we could go through the day. So in addition to not only physical harm, we could also have the mental issues or mental health issues. And mental health issues, we do not forcibly talk about psychiatric issues, which is a whole point for the Moroccan context, since we need a more inclusive approach for those people. We also talk about how stress could actually impact a person and provoke issues to be more prevailing.
Thank you for bringing the part of the mental health. Okay, thank you. The mental health, it's often forgotten. Now, from the human health to the animal health with Fatiha, we do all know that we have zoonotic diseases. It exists, and we need to have prevention. So my question is, what is the What is the most important challenge in preventing zoonotic diseases in Morocco today?
Okay, thank you very much for that question. Okay, so one of the most important challenges is the fact that we need to move from just making policies to actually implementing them, moving from the round table to the field. We see a lot of informal slaughterhouses. We see a lot of farmers without biosecurity checks on their farms. We see them not even knowing the importance of simple vaccinations of animals. And then these are part of things that causes challenges. So we need to move away from making the policies to actually implementing them. And one of the ways of actually implementing them is also strengthening the veterinary services and the community animal health workers. For them, once they're strengthened, they could also help in disease surveillance, in vaccinations of animals, also interacting with farmers to let them understand the importance of biosecurity on their farms. You know, when you have healthier animals, and also when these animals, perhaps maybe for livestock where we consume them, when they go through the normal checks in terms of meat inspection, we know that the community, what we consume is actually healthy. So when you have healthy animals, you have healthy food, and then you have an healthy community. So basically it's just about strengthening the grounds-on practices, changing them and making them better to be able to address the challenges of zoonosis in the livestock sector.
Yes, Fatiha, you and Alauddin, you work, both of you, in agribusiness within the same field, but we can see that you have different perspectives and you do concentrate on different disciplines. So my question is, if you want to connect together, I mean, agribusiness with the animal health, how it could be possible, and how if each one of you see this from his own perspective?
Okay, connecting animal health with agribusiness is very, very important. And one way we could do this is through partnership. Letting the entrepreneurs, the agribusiness side, understand the importance of implementing animal health perspective in the value chain, in the animal value chain, from production to processing, and then finally to humans, and then maybe making profit from it. So it has to be a kind of partnership in terms that also, from the animal health point of view, we know that the farm is strengthened in terms of biosecurity checks and also vaccination. And then we're encouraging agribusiness to also see this as a part of their value chain, the supply chain. You are making sure that the maybe the farmers you're purchasing from, they have good record keeping, they have good vaccination history, they have all these checks in terms of protecting, ensuring that the animals that are produced are healthy, right? Rather than just going through the back door and then not getting the value for your money. So it's more of a partnership. You know that you're getting a very good animal or produce from the farm because of the animal health checks, and then both sides are happy. We're happy that we're able to prevent maybe zoonotic diseases through consumption of contaminated milk, unpasteurized milk, or contaminated meat. And then the agribusiness side, they are making good money because they're getting good quality products from this farm because some checks on preventive livestock or preventive steps have been taken to ensure that. So it's more of a partnership in my point of view.
And I am going to simply complete what Fatih has said. If the farmer can prove that his animals are healthy and traceable, trust me, he will get better prices, he will get more contracts, and then taking care of animal disease is not a burden cost he should bear, but it's something he will get rewarded for. And trust me, if taking care of animals is profitable, trust me, farmers will take care of animals, so there is no issue with that.
Thank you so much, Alauddin. And now I would like to go back to air quality with Iman. And for this moment, for a quick an actionable insight of what solution can you suggest to optimize the air quality within the concept of Morocco?
I think here in Morocco and else, I think the solution going to be a collaboration between the governments by providing strategies, policies, etc. Also, these researchers, so as to provide scientific studies to understand more the atmosphere and the air the ecosystem where we live in, and also the industries to respect more the air quality and air pollution and in their activities, actually.
Yes, certainly this collaboration between government, industry, and scientifics is very important in all fields. And now I'm going to go to the agriculture field with Intisar. Basically the same question. What's one solution, practical one, that farmers can adopt from today to strengthen the soil quality?
What a question. I think there is no miracle solution to enhance soil health easily, because soil health takes time. But one solution that farmer can start with is improving the organic matter of their soils by improving it through well-managed manure or maybe composting, in order to enhance this kind of soil properties to have a positive effect on soil structure and also biodiversity. It's actually a small step, but repeated over time, I believe that the solution will be practical and the soil health index will be improved.
Yes, of course. Thank you so much, Intisar, for your suggestion. And now, before taking the question from the audience, I would like to go back to Ayman for asking him, like, how does the mental health you just talked about fit into the One Health approach, and why it should be a priority nowadays?
Thank you for the very interesting question, because actually, as mentioned earlier, the World Health Organization views health as not only a state of physical well-being, more rather than a physical well-being, mental well-being, and a social well-being. So when we talk about mental health, I would really struggle to imagine that a person going through a state of mental stress or mental disorder could actually take reasonable decisions. So first of all, mental health means stability. And not only that, but also that mental health, whenever a person is in a good mental health, he could easily be socially included in programs. He could also have usually a better health outcome. There's tons of studies that actually discuss the following. Always a good mental health is often linked and correlated with a good physical health. So when we talk about mental health and what creates a mental health, it is not really the medical interventions, because usually medical interventions would prevail after the issue is there. Why do we talk about mental health in the One Health approach? It's because of all the determinants that were evoked before. When we talk about healthy districts, when we talk about green spaces where a person could walk, when we talk about an environment in which the person could flourish, not only physically, but also mentally, that and only then could a person have not only the well-being of his physique, but also the well-being of his mental state.
Thank you so much for your answers. And now I'd like to ask the audience, if you have any questions, please just raise your hand and mention the panelists that you want to respond to your answer.
Hello. Okay. Thank you so much, everyone, for this panel. I would like also to congratulate you for how we could see that dynamics of every part and every component of the system is very working dynamically. But the part that I'm really interested in is the air quality. It's the air quality with the relationship with the dynamics in climate. So my question here goes to Miss Iman. It's about her representation of how each part of the air quality and the system is working. Does the approach that you have working with has that depth that explain the dynamic representation and the relationship between each component? Because when we're talking about the air quality, it's something that we could say it is very local and has so much factors that could dynamically drive it. But when we're talking about the climate, it is something that on the globe scale. So can you elaborate more on this dynamic representation of the system? Thank you so much.
I think the answer to your question that the important interlink between air quality and climate change or climate in general, because even if you mentioned that it's local, but the transport and the different factors can lead to a global situation of air quality we are facing here. And for the interconnection between air quality, climate, and the element of the One Health approach, I think I can told you that the breed you take here without even thinking, as I said, is connected to like a polar bear in the Antarctic, the Amazon the entire Amazon forest. I think it's something that a global scale, and we are facing the same in every the same thing in every area in the world.
I think we have another question there.
Thank you very much. Congratulations to all of you. It was very insightful. I have two short questions for Aladdin and Fatiha. The first one to Aladdin. In a nutshell, what do you mean by we don't need farming, but we need agribusiness in a nutshell for a layman person? The second question to Fatiha. Do you think there is a bi-directional causal relationship between human health towards animal health and then vice versa? I know animal health towards human health, you made mention of that. What about the reciprocity? Do you have any comment on that? Thank you.
So I will start by answering the question. First of all, thank you so much for your question and interaction. So what I said is we don't leave farming at all, but farming is incomplete. The complete part of farming is agribusiness, because as I communicated before, 80% of $1 gain in agriculture profit is done in the process of processing, branding, packaging, and distribution. But if we stick only to farming, it leaves us just 20% or less of the value we get from our agricultural products. And we cannot, I mean, we can survive on that, but we cannot think in a One Health aspect, in a sustainable aspect, if our only concern is to survive on those margins. So we need to integrate a system that is complete. It includes farming at first, then processing to our product, labeling it as a brand and product, then the distribution and the marketing of it, so a farmer can be an entrepreneur in agribusiness and can build a system that can go all the way. So I'm not quite sure if I answered your question.
Okay, if I got your question correctly, you are asking that, okay, we know we get like zoonosis from animals to humans, and then like vice versa, like the effect of humans on animals, right? Okay, good, thank you. So definitely, we're in a very much interconnected world, and whatever affects humans also affects animals. Through our behavior, we actually can affect the human animal health. And I gave samples in terms of animal welfare. let's talk about the farm to the market. So a farmer has his cattle and he wants to go and sell them in the market. Most of the time, when you see the way these animals are being transported, they are transported, or animals are kind of being seen as things that don't have feelings or don't have life. You see them crammed into vehicles, you see them pushing them, throwing them into vehicles and things like that. Left exposed to climate change, climate, in terms of sun, rain, also in the live animal market. Because of these activities of humans on the animals, they tend to get sick. They get susceptible to diseases. For example, if an animal has been nursing, let's say TB or maybe some other diseases, because of this stress this animal has undergone, is going to manifest this disease. And then through manifestation of these diseases, it affects humans. It also gets back to us. For example, maybe tuberculosis, if an animal has been nursing tuberculosis and it comes down with tuberculosis, the farmer or whoever will think, oh, we need to slaughter this animal does not go through the proper checks in terms of meat inspection. They slaughter this animal and they sell every single part of this animal to the market, and anybody could ingest this contaminated meat and then get sick from it. Or in terms of dogs, when you stress a dog too much and this dog maybe falls sick, in a way, this animal could also want to retaliate because of the injustice or the suffering humans have put it through. This animal could get aggressive and then bite humans or even cause more attack on humans. So definitely we're very much interconnected. Whatever we do to animals, it also finds a way of coming back to us, and whatever we also do in terms of the environment, in terms of water, what they eat, and things like that, affects the quality of these animals and the way they interact with us. Yeah, thank you. I hope I've been able to answer your question.
I think we have another question here.
It's me, yeah. Bruno Gerard, I'm the Dean of the College of Agriculture and Environmental Science, and congratulations to the panelists. And it's a question I wanted already to ask this morning. The theme of the Science Week is on convergence. And I have the feeling that in this morning panel, people were still confined in their own disciplines or interest, I mean, somebody said air is important because he was working on pollution. Soil is important because he was working on soils. And Dr. Garnier was the one saying, well, we need to go out of our confidence space if we want to converge. Because if not, we do exposed assembly of research, and that's not what convergence is. So my question is simpler than that, but you are doing a PhD, and a PhD usually is defined by some narrower research. So what's the space did you find here at UM6P to converge? And how you did it? How did you get interest in other disciplines, other area of research, if you did? If you didn't, you'd say, well, maybe it's a missed opportunity. My question is clear? All of you can answer. I mean, it's because it was said this morning by Dr. Garnier that we have to teach differently as well. We cannot now go to the job market saying, well, I'm very specialized in that. The job market still will take you, no problem. But I think if we want to change positively the world and solve problems like climate change, we really need convergence.
Actually, go ahead. Actually, for my case, I can simply say that I never heard about the One Health approach before. So during my PhD, and I'm working on the air quality and its impact on environment, the ecosystem, and etc. Here I found the strong interconnection between the different elements in the ecosystem that we have to find solutions to all the risks we have. So maybe this part that helped me to see different aspects from the environment or environmental sciences or even the human health or animal health, etc. So maybe that, yeah.
Thank you, Professor, for this really interesting question. And I guess the answer will be different from one to the other because it's based on the personal experience that we had. And I mean, talking about my personal experience, that my very humble personal experience that I had working in the region where I showed you the blue-eyed turtle, which is a species endemic to Morocco, where I worked on different workshops with farmers, working on capacity building and also scenario building in order to solve the problems that they have in their region based on the knowledge that they have already. I'm talking about the farmers here. So, I mean, the ideas that we got from these farmers and the data that we collected is really beyond amazing. They were giving us solutions that I would say even in science and in our field, we will consider them as innovative or out of the box or advanced technologies, where they just were suggesting them out of the experience that they had in that region for decades to go with their families, grandparents, and grandparents. So my answer to this question is that it is a part of the teaching experience as well that needs to be changed, of course. I mean, in PhD, as you said, we're not converging, but we are more diverging, and we're specifying for each field that we're working on this field, inside this field, in our case, in the PhD. So the teaching part needs to be changed from if we are seeing the bigger image, but also there needs to be sort of effort coming from our side as well. I mean, you need to go in the field, as most of my colleagues said. We need to go into the fields. We need to experience what our field is bringing into the real world. And that will answer, I mean, this One Health concept and will make us understand more and more what is this One Health concept is bringing to us and what we can or we could bring to the One Health concept. Thank you.
Thank you, Professor, for your question. Actually, from my experience as an agronomist by training, I was used to work only on on-farm experiments when there is only treatments of nitrogen. So there is no interaction with the human. But now, while working in a landscape scale, a large scale, there is a place of the anthropogenic activity. So here the interaction between farmer and the researcher is very important because from the surveys, we see that there is a local knowledge, there is a local practices, but how we can align these local practices with innovation and the research. So we try to build a bridge because at the end, the problem is from the farmer and the solution is for the farmer. So this kind of reflection is very important. So through my PhD, I was not able to be limited only to the agronomic side, but also for the social side by knowing the background, the behavior, the risk attitude towards nitrogen management. They are a little bit afraid to introduce something new for their olive trees, but at the same time, they believe in science, but in a very limited way. So this is our role as a researcher, as a junior researcher, to have this kind of interaction in the beginning of our career to develop new ideas that can be practical and useful in agriculture sector.
I can follow up on that. So I will say that my experience will be different from my colleagues. I am not a PhD, but rather a master student. And my master name is literally agribusiness innovation. So we already have conversions between 3 fields. And since I came here to UM6P and pursuing this master, I've been taught all types of agriculture-related sciences and practices. At the same time, what is this business aspect of it? We've been taught strategy, finance, and at the same time, in order to innovate, we need to enable a convergence between all these fields, so we do this innovation. And we did. And we have a class of entrepreneurship, and we have different projects and startups. Some are targeting soil, some are targeting animal health, some are targeting water. So I think by this combination of those fields and those schools and collaboration, like Fatih has said before, we can actually achieve convergence, and we can do so also with PhDs and research. I believe that if we can blend research and entrepreneurship, for example, is going to be having a very good impact, and we can achieve conversions in that way. So thank you for your question.
Okay, for me, thank you so much for that question. It's very thought-provoking. Based on my experience, because like I said, I have a background in veterinary medicine, I took it upon myself to leave the clinic and take a course in agribusiness to make me closer to the farmers in understanding how, especially livestock, to understand how animal disease actually affect the socio-economical structure in terms of in the livestock production, animal production. So yeah, it gives you an opportunity to like see things from a different point of view. And thank God for this platform. We're able to see that yes, One Health is a global phenomenon, that everyone should understand the concept and should be very much part of it, because we are all interconnected together. And I see that this platform also gives us an opportunity for us to see rooms for how we can actually collaborate. That being said, because another way of convergence that I personally took upon myself is to be a part of the One Health Student Club here at UM6P. And we have like people from diverse background, even from the political side, where you can come together and talk about how each of these tractors are all linked together for global health, in the sense that well-being in animals, in the environment, and also in humans. So yes, this is a very thought-provoking question. We should all move out of our spaces and interact with different fields and see how we could make the world a better place, quote and unquote. So thank you.
Thank you, Professor, for the very insightful question. Well, again, since this is a personal experience thing, I come from a background of public health, so one of the first things that we ever learned was this interconnectivity between different fields. But what really shaped my experience was actually working with vulnerable people. And the moment you start working with vulnerability, you understand that a health outcome, especially in third world countries such as Morocco, is often shaped by determinants that are not health related. So that was the moment that it really struck me. Those people are not actually sick because they have a certain virus or a germ, but it is the conditions in which they live in. Usually these conditions, when you reflect at what they represent, it's usually environments, the soil, the air, the animals that they consume, the food that they consume, their social inclusivity level. So it all shaped my understanding of what health is. And thus, it really gave me an interest to the One Health approach. And I think the UM6P actually provides a really nice, I would say, incubator for such ideas, since that you do not only have facilities to elaborate research, you have great resources and everything, but it also gives you contacts to different researchers from very different domains. And I think that through similar workshops, events, and everything, we could actually brainstorm a lot of ideas that could not only be helpful to the community and us as researchers, but also to real-life people who are suffering from health conditions, who are suffering from, who are not being included into our society, at least socially. Thank you.
Thank you so much. Thank you, Professor, for this question. And within the convergence, I would have to take one last question for you all. Can you please, in one sentence, define a key connection with your field to be strengthened with another field in order to achieve the One Health? Let's start with you, Iman.
Okay. Actually, it's hard to for one sentence, I think the choice of a clean air is the choice to protect our health, our animals, and also the ecosystem where we live. And I want to mention here the importance of the intellect between the pillar elements for the One Health that can go together.
Thank you, Iman. Ibrahim, please.
For me, I think we must bridge the gap between the water infrastructure and the public health policy by, for example, by transforming wastewater treatment plants into a biorefinery, so we can generate a bioresource based on sludge. So this can help us to protect our environment and also secure our food chain. So that's globally what we can do.
Thank you, Yasin, please.
Thank you. This is a quite challenging question to make it into one sentence. And I guess we had already another challenge from Professor with his question. But I mean, to make it brief and to make it into one sentence, I would say providing clear water that is human healthy, animal healthy, and environmentally friendly.
Thank you, Yasin. Intisar, please.
Thank you, Umima, for your question. From my side, I think that if we can create a link between nutrient management, environmental monitoring, and also public health, we can take into consideration a completed nexus that help us to fix the objectives, the results, and also the consequences. So if we had this kind of reflection, I think we can anticipate many challenges that can happen from the beginning of the process.
Thank you, Intisar. Alaaddin, please.
Yes, from my perspective, the One Health is a convergence. If we succeed to make these conversions profitable, then we can achieve a lot of things. Because there, it's not just a responsibility, a sustainable model, theory, it's a visible future with clear action that we can make it through. And the missing element to do so is integrating full processes as the name of agribusinesses.
Okay, for me, from my perspective, I believe one way to integrate the animal health sector is by seeing the perspective of animal health with public health and also agribusiness to be able to produce safer food and have more strengthened the food system for healthier consumption, healthier animals, healthier humans, and also healthier environment. Thank you.
Well, from my perspective, I think that what we actually need is public policies that takes into consideration a vision built on partnership, built on trust, built on responsibility, and a good faith. And we need actually a lot of intervenants working with us, especially universities, to build research and development projects that could actually be impactful and help us manage a better public health in Morocco.
Like what I see from all your answers, that conversions and connections between fields, it's now a need, no more a choice. And I want to conclude by saying that the real challenge starts when we work together. Thank you so much. Please give applause to my panelists. Thank you for your questions and good evening.
Thank you all for this engaging and insightful discussion, which shows that all the perspectives are very important to achieve a One Health concept and for a healthier environment. Let's give them a round of applause. Yeah, well done. Now we will have a 15 minutes break, so enjoy your break and we'll resume shortly with the next sessions. Welcome back, everyone, and thank you for joining us again. We'll now begin our debate session, which will explore the following question. Is One Health a viable model for achieving environmental sustainability? This session will be moderated by Mrs. Ndeye Aminata Sall, a PhD student from Agrobioscience program, who will explain the debate and guide the discussion. So please welcome with me Mrs. Aminata.
Thank you, Haula. Good afternoon, everyone. I hope you enjoyed the break. As Haula said, my name is Ndeye Aminata. I'm a PhD student at the Agrobioscience program at the College of Agriculture and Environmental Sciences. As a PhD student, I'm currently exploring soil microorganisms and their benefits. And I'm fascinated how the smallest organisms impact our largest ecosystem. The Science Week theme this year is convergence, the point where different disciplines meet to solve the world's most pressing challenges. So today, we will focus on the One Health goal. We have spent the day discussing how human, animal, and environmental health impact are one and the same. But as scientists, we must also be critics. Today, we'll move from observation to argumentation in a Lincoln-Douglas debate format. As we face global challenges like climate change, biodiversity loss, and emerging pandemics, the question arises, is One Health a viable model for achieving environmental sustainability? Our debaters will unpack the feasibility and the transformative potential of this holistic model. So please welcome the affirmative team of this debate, Reward Muzirengwa from African Genome Center, Hamed Opeyemi Razak from Center of Remote Sensing Analysis, Rashid Lamzira from Entomology Lab, College of Agriculture and Environmental Sciences, let's now welcome the negative team, Abdelaziz Moter from African Research Center of Air Quality and Climate, Ayman Baki from African Business School, Rabat, and Mabano Trezor from African Business School, Rabat. We will begin the debate now with the affirmative constructive. So, Hamad, the floor is yours. You have 60 minutes.
All right, good afternoon once again, everyone. And my name is Ahmed Opeyemi Razak, and thank you, moderator. So today with my team, I'm standing in support of the notion and this critical question that guides today's debate, that is One Health a viable model for achieving environmental sustainability? And you agree with me that, as we've been discussing since morning, One Health is simply an approach that is built on a simple yet powerful model or idea that human health, animal health, and environmental health are deeply interconnected and cannot be separated from one or another. But before I discuss my arguments, I would like to quickly clarify 3 key terms to guide today's discussion. The first is One Health, which is a multi-sectoral approach a collaborative approach that integrates both human health, animal health, and the ecosystem health. And also, we've talked about a viable model. A viable model is simply a model that is not just theoretically sound, but it is both practical and also applicable, especially in real-world context. And lastly, on the aspect of environmental sustainability. Environmental sustainability simply means the long-term preservation of our ecosystem, the biodiversity, and the environment for the benefit of both present and future generations. So with these three key terms presented, I would like to present my argument, which is the first, that One Health truly is a viable model that can help us to achieve environmental sustainability. And the first part is that One Health truly brings the convergence and the system thinking that we need to solve most of our today's complex and integrated challenges. Take, for example, the problem of climate change, ecosystem biodiversity loss, land degradation. These are not siloed problems. They don't exist on their own. They are integrated problems. And we need complex and we need simple and integrated solutions to also solve this problem. But most especially or oftentimes, solution comes from silos thinking or disciplines working on their own. And because of this, a lot of intervention do not work. But One Earth has stand as a practical solution, though it is not a silver bullet, but it has emerged as a practical solution that can solve most of these problems. For example, when we have problem of deforestation, this triggers the ecosystem and also forces wildlife to come into closer contact with humans, and which by that also increase the risk of zoonotic diseases and also spread of diseases towards humans. So that is one key example that shows us that through collaborative thinking and systemic thinking, we can truly solve one or some of these complex challenges that we face today. And also in addition to that, secondly, One Earth has been proven to be an effective solution, even in a real-world context. For example, we have cases, published papers and cases of application of One Health in countries like Kenya, where One Health approach has been used to control rabies and also Ebola outbreak in countries like Democratic Republic of Congo, which has shown us that this approach truly works. And when done and implemented effectively by collaboration from key stakeholders and key disciplines, it can truly yield the expected result. And lastly on that, I would also like to point out that One Health is preventive. And we've seen cases upon cases whereby a lot of money are being targeted or put into management of diseases or outbreaks. But instead of managing these diseases, we can truly prevent them. And take, for example, COVID-19 for an example. There's a result that COVID-19, the amount of money that goes into COVID-19 or went into management of COVID, reaching about up to $14 trillion could have been prevented if a system like One Earth approach has been put in place to avert such a global scale outbreak and spread. And in addition to that, we've also discussed like even the food organization, the Food Agriculture Organization, which is a FAO of the United Nations, has also reported that One Earth approach could be used to control antimicrobial resistance, which is also one of the key global challenges that we face today. And there's a progression that by 2050, about 10 million people risk their life, and about 10 million lives could be lost due to antimicrobial resistance. And the One Earth has come to be an important solution that can be used to solve this problem. But I would also like to address potential criticism. Some may say One Earth is complex, and that is truly reality. Complexity means reality. It just tells us that we need to seek for integrated and diverse thinking to solve these complex and integrated challenges. And secondly, some may say that the application, or it does not truly reflect in practical terms, which also shows the backbone or the importance of convergence. Because truly, it is not a silver bullet, and also we need different disciplines to work together. So when these disciplines are not together, then we may not see the desired result. So truly, One Health is scientifically viable, it is future-oriented, and it is not only viable, it is sustainable. Thank you very much.
Hello. Okay, thank you, Hamed. So we will move now for the first cross-examination. So the negative team will ask their questions to the affirmative case.
Thank you very much for having me here, and thank you for organizing such an excellent week. Thanks also for the arguments about the subjects of the debate, but for my perspective as a PhD student in the field of air quality, I think that One Health can be, yes, a viable model for achieving environmental sustainability, but it's not enough. It's not enough for tackling the global climate issues that we nowadays can see, and we nowadays have suffered from problems costing life numbers. If you know about recent floods or etc. The other thing is that One Health cannot be implemented. Unlike what someone said during the morning session, I don't expect that the One Health approach can succeed in countries that are low income and middle income, that most of them are in Africa. Why is that? Because we can take care of the human health, but for the animal health and the ecosystems, having them taken care of them also will cost us so much. And I think that, as the proverb says, together we can go far, but alone we can go fast. And that's why I want to focus only on the human health, but take a little bit, but not as much as you mentioned with this importance, the health of ecosystems and animals. With that, I wanted to ask you, how do you see the implementation of One Health, for example, for Morocco and for countries in Africa? Do you see that, can prevent, problems like climate change problems, etc.? With this, I leave it to you for the question.
Well, thank you. Thank you so much for your question. Now, I believe that One Health believes it says that all the sectors and all the disciplines, they're connected to each other. You cannot focus on just one thing and forget about everything else. One Health says that human health, animal health, plant health, soil health, ecosystems health, environmental health, they're all linked to each other. If you only focus on the problems in one sector, the other ones will fall because they go alongside to each other. Say, for example, if I would give you an example from agriculture, okay? For example, if we have like a disease in a crop or something like that, you'd have to provide a solution that would have a positive impact on all types of health. It has to have a positive impact on the crop, on the animals that feed on the crop, and at the end, on the ecology, and at the end after that, on the human health as well. Yeah. So One Health says that if one cornerstone of all these sectors drops, the entire system collapses.
Yeah, I think I get your answer, but I don't think that One Health is as important as you say for solving problems like, for example, let's say extreme events of climate change that, for example, Morocco is, according to the IPCC, is classed as one of the most vulnerable countries with the climate change. I don't understand that. With that, I hand it to my...
Okay. Thank you to the negative team. I think the 3 minutes are done. So we'll move to the negative constructive. So the negative team, you have 7 minutes to present your case.
All right. Good afternoon to the audience. Good afternoon to the affirmative team. Just before I begin, by the way, for the tech team, if they can do something about the noise. So when we're using the stand, they cannot really hear. So so we can have like an interaction. So today's resolution asks a precise question, which is One Health, a model that links human health, animal health, and environmental health, whether that is the right framework for achieving environmental sustainability. Our team will demonstrate today that it is not. But it is not because we disagree with the model. We don't think the model is wrong, but we think it was built for a different purpose. And applying it to environmental sustainability will lead to blind spots that the planet cannot afford. So to evaluate this resolution fairly, the correct value we want to set today is ecological integrity, which should be the ability of an ecosystem to remain healthy independent of human needs. This is the right value because the resolution asks specifically, and we see it asks specifically about environmental sustainability and not human welfare. So the standards we will use to measure whether a model truly achieves that value, our criterion for the day, would be biocentric management, which in simple terms is about governing the natural world in respect of nature for what it is, not only for what it provides to us, not only for what we get from it, but for its own intrinsic value. Because the resolution centers the environment, any model that treats nature as secondary to human health cannot logically claim to achieve environmental sustainability. And therefore, we see this with the One Health approach. Now, that would be the lens through which I believe debates such as this one should be looked at, or should be looked upon at. Now, the affirmative team argues that everything is connected. Human health, animal health, and environmental health, they believe it is inseparable. They are inseparable. We do not disagree with that observation. However, we disagree with the conclusion you guys draw from it. What we disagree with is they claim the One Health dismantles silos, but the evidence shows the opposite. I'll read to you that during the COVID-19 pandemic, One Health principles were widely cited, yet environmental agencies were the first to lose funding as governments redirected all resources toward human medicine and vaccines. The World Health Organization and CEPI and national health ministries, all they absorbed the budget. Environmental monitoring was reduced in over 40 countries according to the United Nations Environment Programme's 2021 report. Now, as we clearly see, this is not a partnership between equals. They're clearly not equal in this context. In practice, when a crisis arrives, we see all the focus shifts to human health, and we see environmental sustainability left aside. Now, the first point of disagreement is that we believe One Health is anthropocentric, which is a fancy word that basically says all of the decisions are around human needs. And that clearly leaves the environmental, again, on the side. So I would give a quick example that in the One Health framework, a forest is considered relevant when it contains pathogens that might transfer to humans. This is a biosecurity mindset. We study and protect nature primarily as a way of protecting ourselves from nature. So that is not for its own intrinsic value. As we clearly see, it does raise some interesting questions. So we can verify this by looking at the language One Health institutions use. Looking at the official One Health Joint Plan of Action published by the World Health Organization, Food and Agricultural Organization, United Nations Environment Programs, and World Organization of Animal Health in 2022, they all describe the environmental as a provider of ecosystem services, where nature in this one context, is serving like very independent, or is serving in a way not independent of its relationship to humans. As we see, it's like a reservoir to humans. Now, the second point is about the abiotic blind spot. We can see that the most threats to environmental sustainability are not biological. They're mostly physical and chemical. Environmental science is largely the study of abiotic factors, which are the non-living components of natural systems. We have ocean pH, the soil composition, and the carbon cycle and the water cycle. These are the systems that make life on Earth possible. I'll give a brief example to follow on this. Following the approach of the One Health, you cannot treat soil degradation caused by industrial agriculture the way you would treat an infectious disease. And that would be a major limitation in this one model. The third point of disagreement is the funding problem. In any framework that ties environmental protection to human health, environmental funding becomes secondary and dependent on human health. And human health emergencies, they always come first. And again, we've seen that in the pandemic. Now, the Global Health Security Index and the OECD's 2022 environmental spending data both show that when health emergencies occur, governments consistently reallocate conservation and environmental monitoring budgets toward medical response, again, leaving the environmental on the side. So how can you say, and this is a question for the affirmative team, that this model will prioritize the environment and basically helps to achieve environmental sustainability? Because even if it says so as in theory or in paper, when we come to actual practice or real-life scenarios, we can clearly see that there is big priorities and the environment is left on the side. I want to conclude with this, returning to the question that the debate asks. Is One Health a viable model for achieving environmental sustainability? I would say, or me and my team would say, that One Health is a valuable tool for managing the boundary between human and animal diseases. We do not dispute that. We agree with that point of view. And we also value collaboration between the two. Therefore, conversion is the theme of today. But what we are demonstrating is that it was not designed for and cannot adequately address the full scope of environmental sustainability. The evidence leads to one conclusion, that One Health is a useful tool in a much larger toolbox, but it is not the toolbox itself. Thank you.
Thank you, Ayman. We move now to the second period of cross-examination. So the affirmative team, you have 3 minutes to ask your question to the negative team. You may begin.
Okay, I'll try to respond to a few points that I've catched from your amazing presentation. The first one is the science related to One Health. Now, if you look up through the publications, you're not going to find that One Health is really mentioned like a lot. But if you look up through publications that they go with One Health, you're going to find a lot. Because, see, for example, from my personal experience, I've started my thesis before knowing what One Health is. I think One Health, the first time it came to the university was in like the late 2022 and the first 2023. I didn't know what One Health is, but I found out that what I was doing goes along with One Health perfectly. You would find so many publications that they do exactly what One Health preaches, but they didn't know that it belongs to something that it's called One Health. So, so in a way or another, they kind of go along with One Health, just not mentioning the One Health word. Now, in terms of sustainability. Now, sustainability and One Health, they share the most important cornerstone of sustainability, which is system-based thinking. They both use this same approach. Now, how does One Health works in terms of going to end with environmental sustainability? It has already been proven that it prevents zoonotic diseases via ecosystems protections. It has already managed to reduce antimicrobial resistance via the reduce of the use of antibiotics. It improves sustainability agricultural through practices, for example, using intercropping or increasing biodiversity. It is adopted by a high-caliber organization such as WHO or FAO, which shows a high level of legitimacy. It is proven in real case studies that it goes along perfectly with increasing health of water, diseases, surveillances. It saves a huge economic cost. For example, it encourages you not to use chemicals which pollutes air. And it targets roots environmental drivers because One Health believes in the prevention more than the correction.
Okay, so also coming to the point of environmental sustainability, we understand that we strongly believe that environmental sustainability is not left out. There is an increase in advocacy for use of biopesticides, and these are aspects we are using in the environment because we see that we have chemical pesticides which are introducing toxins, and also we are not leaving the environment behind, because there is actually the use of BT controls, which you can actually get to use, whereby you can use either microorganisms to actually get to control or even phytoremediation. So the environment is not left out.
So now the affirmative team, you have to ask your questions to the negative team.
Now, such as criticism is very common in the case of emerging big innovative ideas and innovative approaches such as One Health. Even like the climate governance faced like tons of criticisms a few decades ago when they emerged the first time. So this is very common. Now, if you think that One Health, like it's not a viable model for achieving environmental sustainability, can you come up with like a simpler system that is better to do so? Because here is the thing that One Health does differently. It targets complexity, okay? One Health believes...
So Rashid, you might go to the point, so ask the question and they will answer.
Can you come up with a better model? If this is not a viable model for achieving environmental sustainability, can you come up with a better model to do so?
Yes, actually, okay, before I go to the model, I have to go to what you said first. You said that One Health isn't really mentioned within many papers or articles, and that for itself actually is a problem. One Health is a 15+ years framework that was already been there, and it's not really mentioned. The problem is that it's a theory that's not being implemented, and that's the issue that you're mentioning. It's not really viable because its implementation faces issues. So the alternative that you're actually mentioning, we're saying that One Health for itself, it's not enough. It's not enough for environmental sustainability. You said that for zoonotic diseases, I understand. For antimicrobial resistance, it's really understandable because One Health is a very human-centric. It supports human health and animal health, but when it comes to the environment, it turns a blind eye. Because I don't know, the One Health project that wants to solve ground degradation, One Health can come maybe if the environment is the reservoir of a given disease, because it concerns humans and even animals. But when it comes to environment itself, for example, there is a big issue in Africa where the tropical rainforests are being disappeared. But One Health, you can't find an active project that One Health is in there. And also, to go on, I don't know any other project of One Health except for zoonotic disease and antimicrobial resistance and even agriculture that you said on the intercropping. So One Health is really limited. It's a good theory, I understand. It's valuable, but still its implementation is an issue. And that's why for itself it's not a viable model. So it has to be integrated with already existing models so that it can make something that's very tangible and something that's really good. So that's our alternative.
Okay, so thank you. I think we've reached the end of the constructive phase. So now we will move on to the rebuttals. So the first rebuttal is for the affirmative team. Reward, you may begin. You have 4 minutes.
Thank you so much. So we as the affirmative team, we strongly affirm that One Health is a viable model for achieving environmental sustainability. Why? Because, he raised the issue that, it has not been implemented in some other resource-limited settings. But I actually want to assure you that there has been a call, and a lot of countries actually adopting One Health concept. Where I come from, Zimbabwe, and even South African regions, they've actually moved with that concept, where they've developed national biosafety and biosafety guidelines to make sure that they actually get to involve everyone, leaving no one behind, and making sure that even those in the environmental sector are actually quite involved. So we believe that this is a viable model for achieving environmental sustainability. And the aspect of environment which you are making, we see that there are a lot of environmental pathogens that we are seeing in the environment, which actually would have actually gotten maybe some form of antibiotic resistance from human-associated pathogens. So there are now tools that we have been using, which we presented in the morning, the issues of metagenomics. And metagenomics, we are trying to actually understand things that are from the pathogens that are in the environment. We can actually do genomic surveillance using imaging technology like next-generation sequencing. You can actually see to say, okay, where are we having the antimicrobial resistance? And you can track and see, okay, this is where we have seen it. So in that, we're actually taking care of the environment. Another aspect also that is also important, there are issues of biosecurity. Morocco has also adopted a system whereby they've actually also have developed biosecurity guidelines. guidelines for adoption of biosecurity with regards to climatic change, because we see that there are a lot of spillovers that are coming from the environment due to climatic change, zoonotic diseases which are coming. So now we have AI, we have metagenomics, we have all these tools that we have. And now even at UN level, they're actually adopting to say in the Biological Weapons Convention, we need articles that address climatic change. So we cannot say the climatic change or environmental sustainability has been left behind. Also, another important aspect also when it comes to One Health as a viable model is that we have seen that even during the COVID-19 era, there was a call for us to work together, collaboration, and also sustainability even in the terms of agriculture. So this actually helps to actually have conservation of the biodiversity, because even look at CBD, it talks of the Cartagena Protocol on GMOs. GMOs, they say, okay, there can be gene transfers which can be put in the environment. But the fact that people actually giving a listen ear to GMO development adaptation, at the same time making sure that there is no spillovers which might happen in the environment, is actually a sign to show that we care about the environment. So the One Health aspect is actually taking care of the environment and is going to be implemented. Thank you.
Thank you, Reward. So let's move on to the negative rebuttal. This is the final speech for the negative side. You have 6 minutes. You may begin.
Thank you very much. Thank you very much for the affirmative side. They really gave the good points, but they're still limited to the, as we mentioned, the One Health is a human-centric plan. They mentioned examples about the antimicrobial resistance, biosecurity, zoonotic diseases, and genetic modified organisms, the GMOs, but really that also turns back to the human health more than it turns to environmental sustainability. You mentioned that in order to implement these, you have to integrate the environment, of course, but those are not the main environmental factors that the world is facing. When it comes to the major environmental factors that the world is facing, One Health turns a blind eye, as I said. It acts like it doesn't really concern them. And as the topic says, it says that is One Health really a viable mode of achieving environmental sustainability? And we're saying for itself, that's no. Because for its active project, there's no active project that really tackles the active environmental issues that are existing today. As my team mentioned, One Health is a really human-centric process. Even though it's interconnected, even though it's interdisciplinary, all those things, it only focuses on issues that focus on human health and animal health that really relates to the human health. For example, the zoonotic diseases, as you guys mentioned a lot. One Health focuses about zoonotic diseases because they can be intertransmitted back to the humans. So it's a very human-centric process. Due to my points, the PMC peer-reviewed scoping review said that implementation rate of the environmental protection actions under the One Health Joint Planned Action is only 6.5%. It means that for every One Health project, the environmental protection plans that are executed are only 6.5%. Not 65%, not 50%, less than 10%, only 6.5%. And that's a model. In the triad of One Health, they mentioned the animal health, the human health, and even the environment, of course. But when it comes to the implementation, the environment is left behind, less than 10%. To mean that One Health mentioned has the environment as only something that it's mentioned, not something that it implements. And this is the grave issue which shows that it's not a viable model for achieving environmental sustainability. Also, as my teammate mentioned, One Health own joint plan of action describes environment as a provider of ecosystem services. Really, One Health defines as the environment as the provider of ecosystem services, but the environment is more than that. The environment, even though it provides those ecosystem services like carbon storage, pollination, there's some other roles of the environment that doesn't provide those services. And One Health doesn't care about them at all because they have no specific use for the humans. And those are the ones that are being degraded, the species that are being extinct, those tropical rainforests that I mentioned that are being degraded day by day. And there's no active One Health project that could tackle them because it's not really into their priorities. And also, My teammate also mentioned about the planetary boundaries framework, where there is nine Earth system limits that really define the environmental sustainability, which they could destroy the human race and even everything on this planet, such as ocean acidification, carbon cycle disruption, and even nitrogen loading and so forth and so on. And when we come to the One Health approach, only 2 of the 9 are only mentioned within the One Health approach, which is not really a thing you can say it could be environmental sustainable when it comes to One Health. So that of all says that One Health isn't really a viable model. Yes, it's a good model, I understand. It's a good model for human health and animal health and some aspects of environmental health, but generally to the environmental sustainability, it's not enough. Also, to be fair to you guys, you say that it's an interconnected, discipline. Let's say that is true. And let me give you a simple quote that the One Health high-level execution panel discussed within their paper of the definition of One Health. They said, and I quote, there is a substantial political, legal, ethical, and financial capacity that define the complexities in One Health in developing and implementing unified One Health approach. In their definition, they say that it's really hard to implement the unified One Health approach. And even themselves within their definitions say that there's many hindrances, many issues that couldn't make One Health approach be implemented as a whole. So it means that One Health, in order to ensure that it fully adheres and combines those triad, the environmental, the human health, and even the animal health, it needs to be intercombined with other systems and other frameworks that really exist. That is our alternative plan. For example, like the Paris Agreement and even the Kunming-Montreal framework, and even other ministries of environmental that really cooperate to integrate the environmental issues. So the One Health need to, work with them so that they can see how they could make the environmental sustainable, because we saw for itself it's not really enough, according to the examples and definition that I just mentioned. And which comes back to our questions. Is really One Health a viable model? It's not really a viable model when it comes to environmental sustainability. It's viable when it comes to other things, as I said, but when it comes to environmental sustainability, it's not viable because of those issues I just said. It's not enough. And it's only environmental protection implementation rate, so that it's only less than 10%, which is only 6.5%. And even it protects only 2 of the 9 planetary boundaries. So those are the main points. So thank you very much for this.
Okay, thank you, Mabano. Thank you. So we have reached the final speech of the debate. The affirmative team will give their last word. Rashid, you have 3 minutes.
Okay. I'll try to start with what you finished. Now, when we have a framework in progress of a model, it does not invalidate the viability of it. It kind of shows that it's in progress. Now, One Health is not perfect, and that's not the question. Now, is it the most viable model we have for achieving environmental sustainability in a complex and interconnected world? We say yes. Now, it has some weaknesses. Yes, One Health has weak implementations, but it's a transitional issue. Like climate policies, they started slow, but they scaled up and they did just fine. Now, yes, it has no unified metrics, but standardization is actively being developed, and it's been developed by WHO and FAOs, and that's huge. It's too complex to coordinate. Now, complexity, it's not a flaw. Complexity reflects real-world situations. Simple models fail because they ignore the interconnections. They focus on situations itself and they forget. It's like a puzzle that has multiple parameters. You have to work on them, all of them, synchronized. They have to be synchronized so that the entire system wouldn't fall. Yes, it is hard to prove causality, but that is true for all complex systems. Because here we rely on a probabilistic level and we converge that into evidence. Now, the funding silos. One Health is already influencing integrated funding models in global health programs. The affirmative team has shown that One Health relies on 3 core things. It matches reality. One Health's job is not to simplify reality, it reflects reality. The second one, it works in practice. It has already proven that it reduces zoonotics, it reduces AMR through integrated strategies and real-world surveillance. used by WHO and FAO, like I've mentioned before. And the third one is that One Health, it addresses root causes, not symptoms. We believe in the prevention over correction. Now, we agree that the metrics are lacking, yet they are being developed. And like I said before, it shows that the model is in progress and evolving, and it doesn't mean that it's not viable. Now, concerning coordination is too complex. That's not a flaw. One Health loves complexity because it is the real world situation. Now, about data fragmentation, that is a universal challenge in a complex systems. We act on probabilistic, and we hope to end up with the conclusion at the end. Now, what we have when we look at One Health, it's an integrated, preventive, and globally adopted model, though it's still evolving. And the perfect conclusion to this is that One Health, it's not just a viable model for achieving environmental sustainability. It's a must, and it's the best that we've achieved so far, so we just have to believe in it. Thank you.
Thank you. Thank you, dear debaters, for this rigorous exploration of the theme. So now we open the floor to the public. If you have questions or your own perspective on this subject.
Does it work? Yeah. Congratulations. I think that's the session I enjoyed the most since the beginning of Science Week. So thanks for the design. Thanks for your contribution during the session. I have questions because there are terms I didn't hear very much during the whole day. The first thing is the definition of sustainability. Sustainability has three pillars: environmental, social, and economic. When you do put environmental sustainability in front of sustainability, you are giving too much weight to the environment versus the two others. So that brings me to the comment and the question. Because conceptual frameworks and models are easy to set. Operational frameworks are more difficult. So my first question, which model did you see that's working very much, that are dealing with trade-offs? That's a term I didn't hear very much. But when you look at social, economical, and environmental components, you have usually trade-offs. And we're talking about wicked problems here. So if you were in the CASA session on Monday, we talked about wicked problem. And stakeholder view is very different. So there is no right or wrong in your view. So it's much null between you two. I mean, you did develop your arguments very well. But in the real world, solving wicked problems, you have to interact like that and discussing with people who have a different background than yours, a different job than yours, coming from a different institution than yours. And that's the challenge of convergence, is just to be able to align that in a meaningful framework, which starts to be conceptual at the beginning, but needs to be operational at the end, because we want to have impact. So one question to the panelists: use the term trade-off as an affirmative for One Health, and use the term trade-off. So the trade-off is, doing good on one side and doing, it's balancing all those three components of the term sustainable. Thanks again for the excellent panel. I really enjoy.
Okay.
Okay, yeah, thank you, Professor, for that wonderful question. I think, that keyword is actually, let me say, the hallmark, which is trade-off, because, like we said, there is no silver bullet. And as much as we try to solve wicked and complex problems, there will always be need for trade-offs. However, we have to also ensure that we prioritize effectively, which is why we also need convergence and also system thinking across different sectors, whereby we'll be able to ensure that we capture as many areas as possible in this situation. But in terms of prioritization, I would say, because naturally, like we defined, that environmental sustainability is basically the use or the implementation or the services we get from ecosystems, biodiversity, and also natural resources, being used them rightly, effectively, and also preserving them for the sake of this current generation and also for future generation. So I think if you have that in mind, we know that if we preserve our environment, the ecosystem, it can actually, what's the name now? Keep itself running. We don't even really need to do a lot of activities. For example, climate change. We know the source of climate change is coming majorly from global emissions. So if we can cut down emission, that means we can put the atmosphere at peace. Then other interactive or integrated problems can also be solved in that regard. So, but for human models or the conceptual models, we also need to at least prioritize that, because we know in terms of economic productivity and all, we need humans. Because if you say, okay, you abandon human, just focus on the environment and the animal, there will definitely going to be a problem. So it's a complex and wicked challenges, like you said, and we also have to be captured or think about that trade-off, the one that can actually drive us forward to what we are driving at. And lastly, I would also like to also mention, like we are not saying One Health model is a all mark or is just one way solution to all. What we are saying is preventive, because you see, management of some of these challenges cost us a lot in terms of social lives and all of that. And if we can actually prioritize this, we can prevent us from a lot of challenges. Thank you.
Okay, yeah, thank you very much. That's really an excellent question and something that's really missed out within our discussion. Because when you're talking about sustainability, we need to mention the trade-off. One of the examples that I could actually get of the trade-offs, generally in One Health, as I said, One Health is a human-centric. It focuses most on the human health. It wants the human health, to thrive. And it can do it to the expense of the environmental health. Like, for example, I can give you an example of the anthrax. Anthrax is one of the biggest diseases and one of the One Health issues. And it can, the soil is one of its reservoirs, so it can stay a long period within the soil. So when they find, because when they bury the animals that have that anthrax, it can stay there for the long period of time. So when people discover that there's active pores of anthrax in the soil, they can go and quarantine that soil and disinfect it and sometimes burn it. So to mean that the human health is really being benefited, but at an expense of the environmental health. So, which can also prove that One Health can also be brutal in one way to the environmental health for the human health. So that's one example that could top my mind. And yeah, thank you very much. If there is another one with the example, could mention it.
Okay, thank you, Professor. So we will take one last question.
Yes, thank you. Well, really what I wanted to do most is to congratulate you. It's the first time that I'm seeing a debate of this kind in One Health, and it is fantastic. So well done, because by doing that, you've highlighted the strengths of One Health, and you've highlighted its weaknesses. And it's true what you have said about, the limitation of its use with the environmental component. It is something that everybody now is trying to correct, because we have realized, that the environmental component was not addressed enough. The fact that it's difficult to operationalize, you've highlighted as well. And by doing so, basically, I can say you're the best equipped now to implement it and operationalize it, because you know where it stands and what are the weaknesses, and that's a fantastic way to go and now to go a step further and implement it. So well done, congratulations, I'm really impressed. Thank you.
Thank you very much for your contributions, professors. So, as we bring the debate to a close, it's clear that One Health is not only a buzzword, but it's a necessary and complex convergence. Because whether you believe One Health is a viable model or a framework that still needs refinement, it's true that soil microorganisms, animals in the forest, and people in our cities are in one true story. So thank you, dear debaters, for your eloquence, and thank you also to the public's professors for your contribution. I want also to thank the College of Agriculture and Environmental Sciences and also all the other departments involved, and to thank also the team that helped organize this debate, Pape Alioune Ndiaye, Dashna Romain Gracia, and Reda Mokere. So thank you very much. That's the word.
Thank you all for that excellent debate. It was actually a challenging one with the strong arguments with both sides, and it truly gives us much to reflect on. Now we will move to the final session of this afternoon. Students from School of Architecture and Planning and Design will present a project. They will present a project plan that represents the One Health concepts. Please join me in welcoming the speakers. Mr. Mouad Bassim, Mr. Oussama Farsi, Miss Iman Boulmoualem, Miss Oumnia Lgos, and finally, Miss Iman Lamdaghri. The floor is yours.
Bonjour à toutes et à tous. Donc, bienvenue dans notre présentation sur le projet de One Health District. Donc, après une après-midi riche en débats, présentations et informations, donc, nous vous invitons tous et toutes à découvrir un projet qui met en réalité tout ce qui a été dit. Donc, toutes ces informations, toutes ces connaissances, qui essaient on peut dire, c'est de converger toutes ces informations et les rendre concrets. Donc, c'est un projet qui a été fait par nous, une équipe des étudiants d'architecture de la SA+D, donc notre école d'architecture ici à l'UM6P. Je commence premièrement par Iman Belmallem, étudiante en 2e année. Oussama Farsi, étudiant en 4e année. Iman Mdaghri, c'est ça, donc étudiante en 3e année. Oumnia Lgorch, étudiante en 3e année. Et finalement, moi, Mouad Bassim, étudiant en 5e année. Donc, nous commençons notre présentation et je donne la parole à Oumnia.
Bonjour à tous et à toutes. Je suis ravie de vous présenter notre projet intitulé One Health District. Ce projet s'inscrit dans une démarche contemporaine sur la relation entre la ville, la santé et l'environnement. Notre objectif est de vous proposer un nouveau modèle urbain qui va faire face aux différents défis actuels, à savoir les changements climatiques, la santé publique, ainsi que la durabilité des ressources. Commençons tout d'abord par définir c'est-à-dire quoi le One Health. Le concept de One Health repose sur une idée simple mais essentielle. C'est où la santé humaine, la santé animale et la santé environnementale sont étroitement liées. À nos jours, on ne peut pas penser à la santé qu'à travers les hôpitaux, mais il dépend aussi de la qualité de l'air, la qualité de l'eau, notre alimentation et même notre relation avec la nature. C'est là où le concept de One Health vient qui vise à agir en amont pour éviter les problèmes plutôt que les traiter. Après avoir posé les bases d'une définition de One Health, cela nous conduit à examiner son interprétation territoriale et spatiale à travers le One Health District. C'est quoi le One Health District? Le One Health District, c'est tout simplement un nouveau modèle d'aménagement urbain, généralement situé en zone périurbaine. Il est constitué de plusieurs unités qui l'une complémente l'autre, où on peut trouver l'agriculture durable, des espaces d'éducation, des espaces de bien-être. Ce n'est pas simplement un parc ou une ferme, c'est un système intégré qui est capable de restaurer l'environnement, améliorer la qualité de vie et la qualité environnementale et surtout créer une économie locale durable. Notre rôle, c'est de combiner toutes les propositions issues de différentes disciplines et les regrouper sous une logique de convergence afin de créer et de concevoir un district qui est aligné tout à fait avec le concept de One Health. Qu'est-ce qu'on peut trouver dans un One Health District? Le One Health District, on peut trouver des lieux de bien-être qui sont directement liés avec la nature, des zones d'agriculture agroécologique qui sont concrètement s'inscrits dans le contexte, ainsi que des espaces éducatifs pour former et sensibiliser, des zones pour les startups et les entrepreneurs, tout cela dans une architecture écologique durable conçue selon le climat. Notre objectif est de concevoir, vivre et se soigner. Tout cela, ça doit être fait dans une logique interconnectée. Ce modèle présente plusieurs avantages majeurs. Elle permet d'abord d'optimiser l'utilisation des ressources, à savoir l'eau, l'énergie, le sol, ainsi qu'il nous permet de réduire les déchets et améliorer la qualité environnementale et la qualité de vie. Le concept de One Health District nous permet encore de renforcer la structure urbaine, mais surtout, il favorise une économie locale et résiliente. Maintenant, je vais donner la parole à ma collègue Iman Mdakhri qui va vous présenter des différentes références qui ayant mobilisé le concept de One Health.
Alors, comment traduire concrètement le concept de One Health dans un projet réel? Le projet de Kutech Point Hospital à Singapour nous a montré que la nature peut être intégrée au cœur du soin. L'architecture se lance, elle devient alors thérapeutique. Les paysages, les biodiversités et les ambiances participent à la guérison en reconnectant l'humain à son environnement. Sur une autre échelle, on retrouve le Hammarbystadt en Suède qui nous permet de montrer que la ville peut fonctionner comme un écosystème où les flux d'air, de l'eau et les déchets et l'énergie peuvent être intégrés dans un cycle continu. Cette approche ne permet pas seulement de réduire l'impact environnemental, mais aussi de produire un cadre de vie sain où l'environnement devient un levier central de la santé publique. Toutes ces références nous montrent que le One Health ne peut pas se détacher de la logique d'un système interconnecté. Du coup, je passe vers Oussama.
So, before diving into the analysis of the program of this One Health District, let's first start with a simple question. What if this district actually worked like a living organism? Where water flows like a blood, knowledge acts like a brain, and public spaces become the connective tissue. This is exactly what this diagram tries to show by representing all the units of the One Health District and the connections between them. At the first glance, it may look complex, but there is a very simple reading. You can notice that some units are placed outside the gray square, and these elements are not isolated as it may seem, but they represent systems that operate across the entire district. And they include water management, energy production, environmental monitoring, and resource cycles. And these are the infrastructure of the district, and they act as the support layer by distributing resources and enabling everything else to function. And inside the gray square, we found the spaces where daily activities happen, like agriculture, learning, social interactions, production, and wellness. And these depend on the outer system. And the whole tells us one more important thing, is that this district is structured from infrastructures first, then activities that grows around it. And once we understood this global system, the following are zoomed in, where each one focuses on a specific type of connection. So the first type of connection is about essential resources, thinking about water, energy, and nutrition, that without these, nothing can function. And this diagram shows how infrastructure units, especially water systems, energy production, and composting areas connect to almost every other unit. And these elements have the highest number of connections because they supply resources to the whole district. And here the backbone of the system is clearly the water and energy infrastructure, and these elements sustain agriculture, public spaces, and productive areas, making them the essential layer to keep everything running. And now that the district has resources, what can happen next? Well, simply these resources are transformed. And this diagram shows how raw production, for example, agriculture, is processed, shared, and turned into experiences where food can move from farms to markets, to educational spaces, or to tourism activities. And at the heart of the process sits the transformation hub that acts like an interface between production and use by receiving resources from multiple sources and redistributing them into new forms, whether as food products, services, or learning opportunities. But besides the transformation and infrastructure, how can this district evolve over time and improve over time? Well, this is where the loop feedback comes in. And these connections link research spaces, monitoring systems, and educational areas, and by collecting information, these ideas, and share knowledge with productive landscapes and public spaces. And instead of one dominant element, these layers functions through collaboration, where research platforms observe environmental conditions, learning spaces experiment with solutions, and monitoring systems feed data back into agriculture and infrastructure. And together, they create a continuous cycle of observation, testing, and improvement that helps the districts evolve. And finally, the activation links that focus on movement and spatial experience. These connections show how people move between agriculture, learning spaces, social areas, and infrastructure. And the key element here is the commons and resource spine that is designed as a continuous corridor crossing the entire district. This spine is not only a circulation path, but integrates shaded walkways, water channels, gathering areas, and connections between productive landscapes. And it becomes a shared space where people move, meet, and interact, while also supporting microclimate comfort and linking different systems together. And now I will move the floor to Mouad Bassim.
Merci beaucoup, Oussama. Maintenant, nous passons à la concrétisation de tout ce qui a été évoqué. Donc, pour l'hierarchisation du programme qui a été faite par Oussama et pour la définition de One Health et le quartier de One Health qui a été fait par Omnia. Déjà, je vois pas mal d'architectes ici dans la salle, donc c'est une bonne chose. Et on aimerait avoir vos questions à la fin, donc essayez de les préparer. Donc ça sera une bonne chose aussi pour nous, pour développer ce quartier. Donc on entre un peu au projet. Déjà, pour commencer un projet architectural ou urbaniste, on doit commencer toujours par le site. Je pense que c'est une règle fondamentale déjà. Donc, à travers cette carte, je voulais que vous puissiez avoir une idée sur la localisation du site et où se trouve. Déjà, on est dans le petit carré, dans cette zone en jaune, donc on est là, c'est ça l'auditorium. Et en jaune, c'est l'UM6P, c'est notre université. Et pour le site, déjà, ça, c'est un grand site donc, qui se caractérise non seulement par son localisation, mais par les relations qu'il crée. Donc, il vient à l'interface entre l'UM6P et une zone urbaniste dense, donc qui est le début de Ben Guerir, c'est entre la ville verte et Ben Guerir. Et déjà, on peut remarquer un réseau de voies donc, qui vient au centre du site et aux environs, donc qui n'est pas pour nous juste des axes de circulation, mais une trame active qui permet de structurer le flux, de connecter les différents équipements et les différentes fonctions, et même améliorer l'accessibilité à notre site. Donc, à travers cette carte-là, on peut dire que notre site, c'est une zone de transition entre un espace qui est totalement dense qu'on peut dire, est rempli de bâtis et un espace totalement vide. Donc, ce qui rend ce site, ce qui donne une opportunité pour nous à voir ce site comme une zone de transition, une zone d'expérimentation urbaine, donc où on va projeter des fonctions qui vont assurer cette continuité entre la ville verte et Ben Guerir. Donc, on passe à la deuxième carte. Donc, cette carte, c'est pour comprendre un peu ce qui se passe aux environs du site. Déjà, vous pouvez remarquer plusieurs couleurs, ce qui montre une mixité de fonctions déjà. Donc, avec une dominance de la partie résidentielle, qui est en orange, déjà la partie nord, qui est la ville de Ben Guerir, et une mixité où vous pouvez voir plusieurs couleurs, c'est la ville verte. Donc, au centre, il y a l'UM6P, qui est entouré par des équipements de sport, de santé, d'éducation et même une partie résidentielle. Et on peut aussi remarquer qu'il y a plusieurs zones vides au sud de notre site. Je ne sais pas ce que je peux montrer ou pas. Ouais, c'est ça. Donc, on a une zone... On a une zone vide ici, et puis notre site, c'est ça. Donc, qui est un peu en marron, un peu clair. Déjà, dans le site, il y a un programme qui favorise cette mixité. Donc, on a la présence de plusieurs programmes, notamment à travers ces deux carrés en vert. Donc, ce carré-là et celui-là, qui sont le nouveau hôpital de Ben Guerir et un mosquée qui donne sur la route nationale vers Marrakech. On a une partie résidentielle en orange au centre qui est tramée par des voies, donc c'est celle-là. C'est ça. Donc qui est en cours de développement. Et on a un équipement d'éducation qui vient au nord du site, donc qui est en jaune. C'est celui-là. Donc, ce programme existant un peu, ça montre que c'est un point fort, ça montre une opportunité de mixité qu'on voulait déjà créer dans ce site-là. Et en même temps, ça montre un peu, déjà dans la réalité des choses, c'est des fonctions qui sont fragmentées, qui ne sont pas liées entre eux. Donc l'idée, c'est d'avoir cette logique de continuité entre toutes ces fonctions. Et pour faire la continuité de la mixité des fonctions ou de programmes qu'on trouve dans la ville verte vers Ben Guerir. Parce que dans le tissu urbain de Ben Guerir, on voit que du résidentiel. Donc ici, donc on dit toujours que l'architecture, c'est pas juste de construire des formes, mais aussi de donner du sens au vide. Et je pense que pour nous, cette carte du plein et du vide, c'est une carte aussi importante pour nous, pour comprendre un peu qu'on peut dire, la structure spatiale du site et de ses environs. Donc on peut remarquer une grande densité du bâti vers le nord, qui est déjà un espace résidentiel. Et dans le côté un peu droit du site où il y a la ville verte, on peut remarquer des espaces qui sont bien tramés. Donc, je pense que mon collègue Reda a déjà mentionné ça dans sa première présentation, où il a travaillé sur la vidéo de Pixel. Et il a dit que ça ressemble un peu aux formes qui se trouvent ici à l'UM6P, sachant que l'UM6P, c'est une architecture postmoderniste qui se base sur des formes géométriques, sur la symétrie, sur une trame bien définie. Ce qu'on peut déjà remarquer, donc je pense que vous pouvez voir ici l'UM6P. Donc c'est des blocs qui sont bien tramés. Et ce qu'on peut remarquer aussi, c'est que dans la zone résidentielle en haut, on a une concentration de bâtis, mais on a moins de vide. Mais quand on va plus vers la ville verte, on remarque plus des espaces vides. Donc cela, c'est pour donner plus des espaces végétaux dans ce tissu urbain. C'est pour renforcer cette question d'équilibre entre le plein et le vide. Donc, ce qui donne beaucoup de points positifs, surtout dans tout ce qui est en relation avec le développement durable, avec les interactions entre les gens. Donc, c'est des espaces un peu qui ont plusieurs fonctions et qui ont juste du bien pour nous. Donc, c'est à travers cette logique-là qu'on a pu créer notre projet, donc qu'on va présenter par la suite. Et dans le site, on remarque déjà des petits blocs donc, qui sont du bâti, qui représentent le programme qu'on a vu déjà dans la première carte, qui sont le mosquée, l'hôpital, une partie résidentielle et des équipements d'éducation ou des équipements institutionnels. Donc, ici, donc, je pense que pour un architecte, un bon architecte, c'est celui qui comprend bien son site. Donc, la bonne compréhension du site lui permet de concevoir un espace ou un projet qui s'intègre avec son contexte. Et pour nous, donc, pour bien comprendre le site, on doit faire une visite. C'est une visite qui nous donne une lecture un peu sensorielle ou une lecture qui nous pousse ou qui nous montre les lignes directives pour notre projet. Donc, et c'est ça ce qu'on a fait. Donc, on a fait une petite visite du site. Donc, on a pu prendre quelques images qui montrent un peu l'ambiance du site. Donc, déjà pour le site, c'est celui-là. Donc, cette image-là. Donc, c'est un site purement vide. Donc, pour nous, c'est pas un vide. C'est une matière, déjà, c'est une matière qui montre que c'est un territoire qui peut accueillir une nouvelle composition, une nouvelle configuration urbaine. Donc, c'est ça pour nous. Donc, ces images montrent un peu les différents types de bâtiments qu'on trouve aux environs du site. On peut remarquer des bâtiments institutionnels qui sont bien structurés. On peut remarquer des bâtiments résidentiels qui sont en cours de développement. On peut remarquer un tissu urbain résidentiel qui est purement dense. Et dans ce tissu urbain qui est purement dense, on remarque moins d'espace végétal, moins de jardins, moins qu'on peut dire, d'espace de respiration. Donc, ce qui est important, c'est que ces zones résidentielles viennent juste près du site. Donc, c'est en relation directe avec notre site. On passe vers cette axonométrie qui montre un peu les voies. Donc, en général, les parcelles sont souvent définies par des voies ou des axes. Donc, ce site vient, c'est un point de convergence entre trois axes principaux. Donc, on a la route nationale vers Marrakech qui connecte Marrakech à Casablanca, qui est la première route ici à Ben Gurir. Donc, on a envers la route régionale qui connecte Ben Gurir à Qalat Sragna. Et en mauve, on a une route importante pour nous parce que c'est la route qui connecte les différents équipements et les différentes fonctions de la ville verte. Donc, on est déjà assuré que notre site est connecté, donc accessible à travers les différentes orientations. L'idée, c'est qu'on a essayé un peu de faire la continuité de tous ces axes-là à l'intérieur du site. Donc, ces axes qu'on a pu ajouter ou qu'on a pu introduire dans notre site, c'est pour nous, c'est un support de notre projet, parce que c'est eux qui vont tramer un peu notre projet. Et l'idée, c'est que ces axes-là qui sont en bleu ciel, qui sont au centre du site, ça permet déjà d'organiser le flux, de connecter les différents espaces et les différentes fonctions de notre site. Et aussi, ils permettent d'assurer cette accessibilité entre ces différents trois axes qui entourent notre site. Donc, on peut dire que notre site, c'est un point de convergence, donc de programmes, des axes, donc qui permet qui est pour nous un potentiel pour créer un bon projet qui respecte un peu le concept de One Health. Donc, je cède la parole à Iman pour vous présenter un peu le programme de notre projet.
So in this slide, as we can see, we've got the programmatic hubs of the One Health district in their urban context. The idea of this organization is to create a district that is based or not based on isolated functions, but more based on an integrated system where activities support each other. This reflects more of the One Health district approach, which is based on the connection between the environmental health, the human health, the food systems, the knowledge, and economic development. So instead of concentrating everything on one central core, what we did is that the district shows more of the specialized hubs or a series of specialized hubs distributed across the site. Each hub has its own identity, its own role, but it remains connected with the others through proximity, accessibility, and complementary uses. So here we've got a list of specialized hubs, as you can see, starting with the agriculture hub, the learning hub, the tourism hub, the blue-green infrastructure hub, the souk and innovation hub, the Moroccan gastronomy and heritage hub, the agribusiness hub, the composting hub, and finally the health hub. Starting with the productive and agriculture hub, which includes the Moroccan agroforestry farm being unit. This unit is dedicated to productive agriculture through a Moroccan agroforestry approach, which is located in a very open area of the site, which makes it very suitable for cultivation and ecological integration. Also, its location allows it to connect with nearby productive and environmental systems. By combining trees, livestock, crops, it supports a resilient food system and reflects the idea or the sustainable logic of the One Health District. For the Education and Culture Hub, it includes the Living Classroom campus and the Moroccan Culinary Heritage and Food Innovation. For the Living Classroom campus, it shows an outdoor learning space, which is connected to the agriculture and ecological system. And for this hub, its specificity is that it actually showcases the connection between the learning hub and the nature. The Moroccan Culinary Heritage and Food Innovation, it bridges the tradition and the innovation by linking local food production with the cultural exchange and the contemporary activities. Back. For the research and innovation, it includes the Soil Living Lab. It's where we improve the quality of the soil and soil research activities. It includes also the experimental plots. Overall, it supports the sustainable farming within the districts. Then we got the Farming Entertainment Eco Resort in the Hospitality Hub,
For the farm being, as you say, eco-resort, it's located also nearby the agriculture hub. And that's to create a connection between the visitors and the productive landscape that we got inside the district. It offers an immersive eco-resort experience where people can engage with the farm life, with the food production, with the cultural and the education activities that we've got. So it combines tourism, learning, and sustainability within our district. Now I'm passing the floor to Iman Lamdagri to finish the programmatic hubs left.
Mais la question qui se pose, c'est comment traduire cette vision sur l'échelle de notre site et du vécu des usagers. Nous avons imaginé une continuité du pôle santé déjà existant sur la ville verte, notamment le CHE, Aclital et l'hôpital en cours de construction sur le site. Mais en introduisant une transition progressive de l'échelle technique vers l'échelle naturelle. Le parcours va débuter bien évidemment par des dispositifs médicaux tels qu'un clinique, laboratoire, des medical gardens, intégrés dans un paysage inspiré de la pharmacopée traditionnelle marocaine, avec des jardins, des dispositifs pédagogiques et des espaces de consultation, mesures de tension, de diabète, machin. Puis une transition s'opère de l'échelle physique vers le psychique à travers un pavillon en bambou conçu comme un espace sensoriel apaisant. Enfin, cette expérience se prolonge vers des soins naturels, notamment avec des hammams qui devient un exemple pertinent de la dispositif thérapeutique dermatologique, reliant la tradition et la médecine contemporaine. Au-delà du soin, comment intégrer la dimension productive dans une logique de One Health? Le composant d'agribusiness structure le projet à travers une organisation basée sur le flux. Elle permet d'accompagner la transformation des produits depuis la matière première jusqu'à la production finale. Sa proximité avec le pôle de compostage permet de réinjecter les déchets organiques dans le cycle de production, assurant ainsi une continuité de système et une valorisation des ressources. Sur cela, on passe d'un système linéaire vers un système circulaire. Et après, l'autre question, c'est comment activer cette production et la rendre visible sur la ville. C'est là qu'intervient le Green Startup Incubator, positionné en face de souk. Cette proximité permet de réduire la distance entre l'innovation et la réalité. L'idée, c'est de directement prototyper et tester et commercialiser sur place. Le souk devient, sur ce cadre, un espace d'expérimentation et révélant concrètement la dynamique économique de la ville de Ben Guerir et de la ville verte. Et comment s'assurer de la durabilité de ce système sur le long terme? Le compostage joue ici un rôle clé en transformant les déchets organiques en ressources réutilisables, notamment comme matière première sur le pôle d'agribusiness. Il vient de clôturer le cycle de production en assurant une boucle vertueuse et régénératrice. Enfin, comment relier toutes ces fonctions entre elles en répondant au contexte climatique? Le parc central agit comme une épine dorsale du projet. Ces traverses piétonnes qui connectent toutes les fonctions entre elles et assurant ainsi la continuité avec les zones résidentielles dans un climat sec tel que de Ben Guerir. Il permet de créer et de générer des microclimats et d'apporter de la fraîcheur et de confort au sein du site. Au-delà de son rôle environnemental, il devient un espace de vie reliant la santé, l'éducation et les usages pratiques. I'm passing the floor to Sam.
And now that we understood the One Health program and knew where and why we put each unit in a certain positioning of the district, let's discover together the strategies that are adopted and adapted to the One Health district. So the first strategy is the hydro-solar system. This system harvests solar energy through photovoltaic panels, then converts it into usable electricity. The produced energy can cover the needs of residents, including lighting, heating, and daily electrical use, equivalent to powering a house for efficient energy house for 4 people. Then this approach follows the vision of the Green City of Ben Guerir, which aims to create a clean, zero-carbon environment by relying on renewable energy sources. Alongside the energy production, we have this system that integrates the hydro harvesting, where rainwater is collected from roofs and stored in tanks, with each house having its own reservoir. And the collected water is filtered, then reused when needed. The system captures rainwater over an area of approximately 225 square meters, providing 20 liters per person per day, enough for drinking, cooking, cleaning, and bathing. And this strategy therefore combines energy independence and water self-efficiency at the housing scale. And the second strategy focuses on circular water management through 2 complementary systems, the blue chain and the black chain. The blue chain that deals principally with gray water. This water is coming from kitchens, showers, and sinks. And this water is filtered, cleaned, and disinfected, then used for irrigation and landscape maintenance. And the black chain that handles the wastewater from toilets, instead of treating it as a waste, this system transforms it into useful resources by producing biogas that can be used for cooking or energy, and converts the remaining materials into safe organic fertilizers for agriculture. And both chains work together and are managed by a smart control system that monitors water levels, predicts rainfall, and optimizes water use across the entire district. And this ensures efficient reuse and reduces pressure on fresh water resources. And now I'll move the floor to Mouad Bassim.
Merci beaucoup, Oussama. Il y a un point à mentionner déjà, que le programme, c'est juste une traduction de plusieurs concept notes et de plusieurs cahiers de charges qu'on a reçus à travers plusieurs départements. Et on a essayé de trouver une relation entre tous ces espaces-là et toutes ces fonctions-là. Et c'est ça notre projet, c'est ça le programme que Iman ont présenté. Donc, on revient à notre carte du plein et du vide. Donc, ici, ça montre un peu comment notre projet a été structuré, car en général, notre objectif n'est pas juste de remplir le vide, mais de trouver un équilibre déjà entre le plein et le vide, donc entre l'espace bâti et l'espace non bâti. Donc, en général, le projet transforme un espace un peu indéfini en un tissu urbain un peu, qu'on peut dire, lisible, connecté et habité. Donc, en continuité avec son environnement. Donc, vous pouvez déjà remarquer des blocs qui sont bien tramés, qui suivent un peu la trame des voies qu'on a attribuées à ce site, ou qu'on a créé dans ce site-là. Donc, vous pouvez voir déjà, entre les bâtiments, il y a des espaces ouverts, donc des corridors qu'on a essayé de créer, donc pour favoriser un peu les espaces verts, pour les montrer, pour les rendre plus lisibles. Et même pour les espaces bâtis, on a essayé un peu de créer la logique entre eux, de telle façon que ça reste, on peut voir cette continuité entre eux déjà. Donc, l'autre remarque déjà qu'on peut voir, c'est que il y a une petite ressemblance entre le bâti de notre site et celui de la ville verte. Donc, car pour nous, la ville verte, c'est un projet qui est un projet qui a pu répondre à ce concept, qui a pu répondre d'un degré à ce concept de One Health. Donc, pour nous, notre site, ça vient pas pour donner des fonctions qui sont nouveaux ou donner un plus, mais ça vient dans la logique de la continuité de ce qui existe. Donc, l'objectif de ce projet, c'est d'articuler, c'est de connecter toutes ces fonctions-là et de renforcer cette relation entre toutes ces fonctions-là. Donc là, c'est un outil essentiel et important pour nous qui est le plan. Donc on passe au plan masse. Donc déjà, la première remarque que vous pouvez déjà... la première chose que vous pouvez remarquer, c'est la grande présence de la couleur verte. Donc là, c'est des espaces verts. Donc on a essayé un peu de créer. Vous pouvez déjà remarquer qu'on peut dire, un espace en bleu ciel qui vient au centre. Donc c'est un bassin de rétention donc, pour collecter l'eau qui circule déjà dans le site et pour donner plus de fraîcheur à ces habitants-là, parce que déjà au centre du site, il y a la partie résidentielle. C'est ça déjà qu'on peut remarquer dans notre campus déjà. Donc, je pense que vous avez une idée déjà sur les bâtiments du campus. Donc, on a des bâtiments qui sont dans la couleur un peu orange. Et on a le premier bâtiment du pôle sport qui vient avec une couleur un peu bleu ciel. Et qui, déjà, on a qu'on peut dire, la piscine donc, de notre campus, c'est implémenté dans ce bâtiment-là. L'idée, c'est d'avoir comme l'oasis qu'on trouve dans le désert. Donc, on trouve déjà au centre un espace donc, qui contient du lot, un espace de fraîcheur. Donc, c'est ce concept-là qui s'est traduit dans cette conception de ce bâtiment-là. Donc, à travers ce plan masse, donc, on peut dire que notre projet ne propose pas simplement une organisation urbaine, donc, mais un véritable écosystème où les dimensions humaines, environnementales et productives convergent et se renforcent mutuellement. Donc, et c'est ici qu'on revient au mot, le sujet de cette Science Week qui est la convergence. Donc, on passe par la suite pour voir un peu l'ambiance de notre projet. Donc, pour voir un peu la matérialité, la végétation utilisée et même l'ambiance qu'on a voulu créer dans notre projet. Donc, ici, c'est au centre de la partie résidentielle. On peut voir ce bassin un peu de rétention où on a un écosystème qui se crée à travers cet espace-là, qui est un espace vert qui vient au centre du bâti. Donc là, c'est le One Health Medical Garden. Donc, c'est une extension du pôle de santé. Donc, on peut voir une interaction entre les gens, des espaces où on peut s'asseoir, des espaces de respiration. Donc là, c'est le souk, donc qu'on a essayé de le rapprocher un peu de la route nationale vers Marrakech pour avoir plus d'accessibilité, soit par les gens qui habitent dans le site, soit par les gens qui visitent Mengrir. Donc ici, on a l'espace un peu, la continuité des jardins qui est en relation avec le pôle de santé. Donc on peut voir un pavillon ici en bonbon donc, qui est créé pour ces gens-là, pour ces habitants-là. Donc c'est un espace aussi de respiration pour eux. Donc je pense que c'est tout. Merci beaucoup. Et si vous avez des questions, n'hésitez pas.
Thank you for this wonderful and excellent work, developing such a complex master plan and connecting multiple disciplines in one district is not easy. It's truly a wonderful work. So you have a question? Yes, go on.
Be working. Oh, okay, good. Yeah, I think it's amazing. It's ambitious. It's impressive. You've put in a lot of elements that need to be in the One Health approach. We can use the One Health concept or the One Health approach. The approach means you integrate it into a lot of different elements. So I think it really would be fantastic if it could be implemented. Then really developing a model. And I think you can strengthen it even more by trying to consolidate. You've started to put all the different elements and some feedback loops and some relationship between these elements. Actually, you can strengthen this into a system map, a true system map. If you find there are models of system map that you can use showing the feedback loops, and you could show how all these feedback loops are going to improve the health of all. You've got a hospital which is going to be in there. It has been showed, it has been proved that by exposing patients to green spaces, the recovery time is much quicker, is much lower. So that leads me to also to strengthen this pilot and potential project, or maybe it is already a project. You would need to capture the impacts. That would be important. That is complex with One Health initiatives, One Health projects, but by having the beginning of a framework where you capture the impacts of what you're doing, that would be really meaningful. And it needs to be adaptive, it needs to capture what's going to change, but that would certainly strengthen the whole initiative and also allow it to be replicated or and follow how it evolves, because as we know with One Health initiatives, things evolve. You need to implement what we call an adaptive management method, because you need to follow how it evolves and go with the flow, because you create synergies between elements. So that means you're going to have anticipated impacts, but also unanticipated impacts, which can be positive or negative. And that you need to capture to make sure you always address these impacts if they go in the wrong way. So well done on that. I'm really looking forward to see how this is evolving. Thank you. Just another comment also. I could see that obviously as you've understood, I love biodiversity and I think it's so important. You've put it in the middle, which is great. But biodiversity, as you know, will expand. So would there be room to have another sort of biodiversity elements, maybe on the side, which could grow if needed? But again, I know you've put a lot of thoughts into it, but that's just, wherever I can see biodiversity growing, I'm all for that. So thank you again.
Thank you. Since we have already a documentary in this session, so like to respect everyone's time, we will take only this the first question, and I will thank all the speakers for their presentation. It was a great work, and thank you all for your comment and making it till the end to this session. Also, I want to thank all of the participants and all of the speakers of this session that gives really a contribution to make this session a success. Thank you, all of you. Have a great rest of the day.